That's something you can make happen, Cheryl? It says we're being live streamed.
I see it now.
We're good now? Thank you, Aaron. So we'll start with a report on LIFT, which is the leveraging investments so families can thrive. A report that's now available. We'll have time for questions and then some public comments. Then we'll hear from the LIFT work group about their report. And then a presentation on FedCap and Aspire. And that will complete the morning's work with committee time for questions after each piece. Good morning, Representative Perry. So same thing as before, try and leave your video on as much as possible. I may need to drop off periodically for reasons beyond my control, but Representative Meyer has been fully warned and is ready to jump into the fray. So why don't we go around the horseshoe and introduce ourselves, the virtual horseshoe, and we'll start with Representative Zager.
Thank you very much, Senator. My name is Sam Zager. I represent District 41 in Portland.
And I see Representative Lemelin. Are you, who's dressed up as Representative Griffin or designated?
The reason for that is because I didn't get a link to join.
Oh, okay.
So I had to ask Representative Griffin to send me a link, and of course it sent me hers. So that's, but I'll change it. I'm Representative Michael Lemelin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Glad you could join us. Representative Stover.
Good morning. My name is Holly Stover, and I represent the towns of Boothbay Harbor, Southport, Edgecombe, West Port Island, and part of South Bristol.
Senator Baldacci.
Good morning. My name is Joe Baldacci. I represent the city of Bangor and the town of Herman. Good morning.
Good morning. Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Connor.
Good morning. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Craven.
Thank you, Mr. Chair. My name is Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan.
Thank you, Mr. Chair. My name is Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Javner.
Good morning. I'm Representative Kathy Javner, and I represent House District 141, which is in Penobscot and Washington County, and it is wonderful to see everyone.
Representative Griffin.
Good morning, everyone. I'm having a little technical difficulty. It's good to see everybody. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levan, and Pedesque.
Senator Moore.
Good morning. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Good morning. Thank you, Mr. Chair. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott, where I live, and parts of South Berwick and Kittery. And I echo Representative Javner. It's wonderful to see everyone.
And I echo that too. My name is Ned Claxton. I represent Senate District 20, which consists of Auburn, where I live, Minot, Mechanic Falls, Poland, and New Gloucester. And this morning we're joined by staff that's made this possible. So Erin.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts staffing this committee. We just wanted to let you know that the materials for today's meeting are on the committee materials website under the interim materials tab, and that you should be forwarded public testimony that you've received, and that'll be posted on the website there later.
Great, thank you. And a room.
Hi, I'm Anna Broom. I'm the other legislative analyst in the Office of Policy and Legal Analysis. And just a reminder that to everybody, the world out there, that our office doesn't take positions on bills or any other issues.
And our clerk this morning is Cheryl McGowan.
Am I still echoing?
You
Yes.
are.
My name is Cheryl McGowan. Thanks.
Thank you for being here this morning, Cheryl. We're also joined by some folks who are going to provide some testimony. I see Director Pilati. You want to introduce yourself?
Good morning, Senator Claxton, Representative Meyer, and other members of the HHS committee. I'm Tony Pilot, Director here at Family Independence. Thank you for having me.
And we're joined by Bethany Ham, who will be presenting later on.
Hi, good morning, everyone. Good morning, Senator Claxton and Representative Meyer. And it's good to see some of you that I've worked with in the past and haven't had the pleasure of working with some of you that are now on the committee. So thank you for having me. I am actually one of 3 deputy commissioners here at the Department of Health and Human Services.
Thank you. And Molly Bogart.
Good morning. Good to see you all. I'm Molly Bogart, Director of Government Relations for the Department of Health and Human Services.
And she'll be presenting later on too in our morning. We'll take a mid-session break and then come back for the second part of the hearing. So, so to begin, we now have access to the report that we've been looking forward to seeing. And we're going to defer to Mr. Pilot. Sorry about the pronunciation the first time. And I ask you to present the measures of child and family economic security report.
And I can actually kick us off just briefly, and I'll be sharing the slides. So let me
please
start that. All right. Can everybody see the PowerPoint?
Yes.
Great. So we will be discussing, as you mentioned, Senator Claxton, 2 legislative reports. First, the measures of economic security and as well as the systems improvement working group report that you received last year. And so these were both due pursuant to LD 1774 in the 129th, which was an act to reduce child poverty by leveraging investments so families could thrive. The working group met from November 2019 to January 2020, and that report was submitted last year. And then the measures of economic security report is the first iteration of what will be an annual report going forward, with a number of metrics related to the programs that the Office for Family Independence runs, as well as child and family economic security. And then, as you mentioned, after we present those 2 reports, we'll respond to some specific questions that we received from the committee related to the Aspire program. And we will break a few times for questions and, of course, any other time at the pleasure of the chairs.
Thank you for that, Molly. And I will point out that this is the next step in making sure that the Health and Human Services Committee is well informed about these series of reports. So as we begin to think about whether we need to introduce new legislation to strengthen or improve what's been done before. So thank you for that, Molly.
Great. And now I will hand it off to Director Pilot to start walking us through that first report.
Great. Thank you, Molly. So the first part of this PowerPoint will be running through a few data sets that are just representative of the LIFT report. LIFT report, of course, has a lot more detail and some other data sets that should be factored in. But our goal is to give you a sense of the baseline data that's been collected and give ourselves a starting point for where we'd like to see the policies take us to improve upon some of the social services that we deliver here at OFI. So this slide really is just showing all of the specific statutory data points that we needed to provide in the first iteration of the report. As we run through some of these data points, I'll try to keep it peppy and not get us bogged down too much. We will get to some policy discussion after we get through some of these initial data slides, and really looking for the committee to provide us some feedback on, are we meeting the marks with some of these data points, or are there other data points that perhaps we should be trying to dig into to better inform the committee and the department? I think we're good for the next slide. Thank you, Molly. So on this slide here, and I'll glance off to the left here a little bit sometimes because I've got the PowerPoint up in a big screen next to me here. The key metric here really is just the green line, which shows the percentage of families with children that are at or below the 100% federal poverty level that are being served by our TANF cash program. So as you can see, again, we're looking at about, 26% or so of folks at 100% federal poverty level or below that are currently on the TANF program. Next slide. Now this slide here is, again, the key data point you want to focus on is that green line, which shows about 50% of children under 5 years are receiving, 5 years old are receiving TANF or WIC benefits. I can pause briefly as we work through these, Senator and Representative Meyer, if you want to ask questions, or we can just keep going forward and then take some questions after we get through all the data slides. Okay, I see that.
Why don't people put up their hands after we get done with the presentation, and I'll try and recognize folks who have the electronic hand up under raise hand.
Great.
Thank you.
Thank you. All right, Molly, next slide, please.
I jumped the gun a little bit, so this is the next one.
Oh, okay. All right. Again, the green line shows that children under 5 years old are receiving SNAP and WIC benefits. This is about 45%. Next data point. Now this is actually an interesting slide that I needed to take a few minutes to really digest, but I think the big takeaway here is what we're showing is when people close off the TANF program for 3 quarters, 9 months, we're showing that this percentage of the population does not have any earnings in their household. Now, there are other incomes in the household, unearned income, disability payments, for example. But I think, the key takeaway here is there's some opportunity for us to look at perhaps, improving our transitional services for folks as they move off the TANF program, and also revisiting employment readiness training while they're receiving TANF, to make sure that when they are moving off the TANF program, they're best prepared to enter the workforce. So a lot of data there, and I think in the LIFT report itself, there's some other data points that help with the context of this particular slide. Next slide, Molly, please. Now on this slide, we're showing educational attainment by individuals who are receiving TANF, and I think obviously the blue is high school or equivalent, is the majority here, and I think that just shows again where we can improve on educational services while people are on the TANF program and helping them move forward with attaining higher levels of education. Next slide. Now this slide here, we're showing food supplement recipients by age. Certainly the majority of the population is in the red bar there, the 18 to 59 age population. And percent of food supplement recipients with a disability. Again, the green line is the key focus here for this slide, for this particular chart. We're tracking about 30% of our food supplement recipients with some form of disability. Okay, and then on this slide, we're just showing you the total enrollment of individuals receiving main care. And we're also showing you the average monthly enrollment for main care. And so there's a little bit of a variation there. People have annual recertification. So that's why the two different data points that we're showing you. And then measures of economic security. These are some cup care processing times. Always striving to improve on how quick we can get services to children in need of medical assistance. The metric, of course, is broken out. 45 days is the threshold at which we start providing state-funded services to households that we haven't made a determination on timely. So if you total up the different percentages for 30 days or less, we're about 55–60% where our timeliness is under 30 days. And that's a fairly good metric, but always looking to improve there. And then the next slide is the very popular call center metric, which, as you can see, quite a wait time until about June 2019 when we implemented a statewide, I like to call it a soft welcome center where folks can get simple questions about application status, recertification status, where to apply. Did my information get received by an eligibility specialist? This call center has helped tremendously at the amount of wait time someone has to go through to talk to a representative from the Office for Family Independence. This helps cut down on constituent concerns, complaints that we receive either at the office level, the department level, or through the governor's office. So I think this chart shows that we've done a good job at turning around our wait times with this call center approach. And I think that's the end of our data point slide. So maybe this is a good place, Senator Claxton, to maybe take any questions if folks have any.
I struggled with some of the data, and I appreciated the graphs when I saw them. So if we could ask Molly to go back to the very first data slide, and why don't we just work our way through those and make sure everybody has a chance to ask questions about them before we get to the next portion.
Sure. I will do that. And I do want to note that the next portion sort of talks about how we respond to this data and address it. And so I just want folks to know that that's coming.
Yep. Yeah. I just want to make sure I understand where we're starting so I can understand where we're headed. So this is a total number of families that are involved with TANF, right? By
Correct.
year.
Right.
And then those with children income below 100% is the taller red bar.
That's right.
Okay. Okay, so that means that in the neighborhood of 25 or 30% of people are getting TANF who are at less than 100% of the FPL. Is that correct?
That is correct.
Okay. All right. Now, do people have questions about this? I see a hand up from Representative Meyer.
Thank you, Mr. Chair. So, and thank you, Director Pilot, for being here today. So this then would reflect that 3 out of 4 poor kids are not getting help from the program. And so I'm wondering if you could talk a little bit about what you feel the barriers are for those families.
Well, the obviously the federal poverty level is limiting. What we're comparing here is, families that are below 100%, and then those that are actually receiving the TANF program. So it could be people don't want to provide child support information on absent parents. That's usually a requirement that has turned people off in the past. Now, we've changed deprivation requirements for TANF recently, so it could be that there's a little bit of a lag for understanding of that change to the program. It could be that there is just a general lack of outreach on the TANF program. For example, SNAP has its own outreach plan that we implement. It could be that perhaps TANF would need an outreach plan as well, so that it's more prevalent and people are more aware of it as an option.
May I chime in here just a second, just to add on to what Tony
Sure.
was explaining, or at least giving you some, or providing you some, maybe some rationale as to why this number does look strikingly low compared to what, how many families potentially could be eligible out there. And I think that there's a lot of variables that probably make up some reasons why they're not eligible. I think, to name a few, they may not be eligible because they've timed off public assistance. TANF program has a 60-month time limit unless you meet one of the exception or extension criterias. It could be that we currently have a policy in place that applies a full family sanction when they're not in compliance with the program. However, that policy is changing thanks to legislation that passed recently. So that may have a positive impact on at least enrolling families, even if they're child-only cases. So again, I would hearken back to probably what Tony said, which is there could be better outreach strategies associated with this program. I think there's some stigma related to it that we need to get at and make sure that families understand the benefits of this program and how we can assist them into economic stability. But again, there are also system processes that we could probably take a look at so that the access points at which families are signing up for benefits and are being educated about benefits could be improved.
Yeah, and I would just, I mean, that's a good point that Beth brings up at the end. Our eligibility system is an integrated eligibility program. So when someone comes in and they're looking for just main care or SNAP, eligibility specialists are trained to recognize and speak to the other programs that that individual may be eligible for when they're in to apply for a particular service. So we do have some outreach, and obviously we train our staff to acknowledge the full scope of needs when somebody comes in to apply for a benefit.
And I'll close it out here and let you go on to other folks that have questions. But I just wanted to make mention too that within the culture of the department, you know, we need to recognize that it's very traumatizing for families to come in and apply for these programs. And so we have to have a welcoming culture that treats people with empathy and respect. And certainly we are doing a lot of work on that front.
Thank you, Deputy Commissioner. Does that come close to answering your questions, Representative Meyer?
It's a start.
Yeah.
Just one quick follow-up out of curiosity. Do some of the families who are eligible but are not receiving the benefit, does this reflect them having been moved off of the program due to punitive or restrictive policies?
No, this particular data point doesn't reflect. We're counting all of the individuals, whether they have, I think you're referring to like sanction status, perhaps.
Right.
Yeah, no, this is inclusive of everyone that would be included
Eligible.
on, yes.
Yep. So we're missing the vast majority of poor families with this safety net program.
Okay. Representative Madigan, you had a question?
Yes, and I appreciate Mr. Pilot and Ms. Ham answering these questions because mine's sort of related. On this graph, I believe Representative Meyer was asking about like, hey, what about all those people in the red bar? And so my question is kind of trying to drill down in that is, was there any effort to figure out why people were eligible but did not qualify? We've heard a lot of kind of speculation on why that might be, but was there any collection of data as far as what the percentages of people who may have reached the 60-month limit or may have been sanctioned or may have not known or, you know, had difficulty accessing it in other ways? And also, is there any difference in geographic distribution, you know, people working out of different offices within the department?
Go ahead, Beth.
I was just going to start off, Tony, and then please chime in. But Representative Madigan, you make very good points. And I think it's really great that we're having this discussion around what the statute required the department to kind of present to you. I think this is an opportunity for us to talk about how, as Senator Claxton mentioned earlier, how we could provide additional data that really helps to better inform what's the absolute picture, what's the big picture associated to this data point. So I totally appreciate that question, and I know that the department stands ready to talk through better opportunities to have a fuller picture here.
Representative Stover, you had a question.
Thank you. And thank you, Director Pilot and Deputy Commissioner Ham. My question is about those families where, I'll just simply say, where there's open protective cases who may have been receiving TANF and other benefits and the children have been removed. Is there still an attempt to retain some of those, that the custodial parent who has lost temporarily, there's an open protective case, so the children are not at home placement. Is there an attempt to continue benefits to that parent as they work through reunification because understanding that losing all of that benefit, particularly the cash, really limits someone's ability to do what they need to do to get their children back. And I know when I worked for the department, we worked on a pilot around this, and it was really great. And I'm just wondering, are you still doing any of that work?
Well, we partner with our Child and Family Services office often on different items. I can't say that specifically there's been a large amount of effort on that particular scenario that you're mentioning, but of course, we do everything we can to ensure the benefits are remaining in the household for which they're intended. Beth, it looks like you want to say something.
Go ahead, Representative. I
No,
don't want to interrupt.
I can't see people, so go ahead, please.
I know exactly the pilot that you're referring to, the reunification pilot. So there were some challenges with the way that eventually was structured, I think, Representative, which didn't have ultimately the full impact that we had hoped to see. So certainly this is worth a further conversation. I think, this goes into a lot of various opportunities to assist families, particularly those families that are struggling with substance use disorder, who are trying to reunify and complying with their reunification plan, because you make a very good point. It's very difficult for those parents to maintain stability while they're in the process of losing their cash benefit, which supports their housing, which then supports their various amount of things. So, and they're required to do a lot, right? They're required to go to multiple appointments and be at several different places. And so it does add stress when they lose the cash benefits. So we certainly acknowledge that, and happy to talk with Director Pilot and Director Landry to see if there's maybe some opportunity here.
Thank you for that, Deputy Commissioner, and Director Pilot. I appreciate that, because I do, as we look at some of the other issues this committee and government oversight are looking at around child welfare, this is one thing, both poverty and also the ability to continue any level of benefit. For instance, you have to have a home in order to have your children come back to you. And in order to maintain that home, oftentimes that would be the link right there, is the ability to pay for that home. I did have one other question, if that's okay, chairs.
Please.
Separate, but somewhat related. It's sort of often a different question area, but how many families, if you know, who are experiencing domestic violence are on TANF, how many hardship exemptions annually do you think you're providing to those families where domestic violence is the issue that is keeping, for instance, keeping the person from returning to work or being able to do certain things while there's an active DV case?
That's, yeah, I'm sure there's some of those cases. I don't have a data point readily available, but it's certainly something we could follow up on for you.
Thank you. That would be helpful.
Representative Connor.
Thank you, Mr. Chair. Thank you, Director Pilot and Deputy Commissioner Hamp. I was just curious where the data comes from for the income, number one. And number two, it seems like there's a negative connotation to all of those folks that are at the federal poverty line that are not on the program. But my question really is, are there checks? Is there data? Is there verification that those folks are doing, how can I say it? They're living within their means, or they're doing something different that the other folks aren't doing, that the children are okay, they're getting the food they need, they're just living a different lifestyle than the other folks that we may want to, encourage versus say, oh, you're not making enough money, so therefore you should, come on our program. So I'm just curious if there's any of that data there. Granted, I know they're not making a lot of money, but are we seeing the full picture that and maybe only one parent is making money that is reported, and the other may be earning enough to feed the children under the table per se. I'm just trying to look for all angles here.
Yeah, I mean, I think we share a mutual goal in this report, which is to better inform our office and the department on gaps and areas where we could improve with our data. So happy to hear any feedback on other data points that we think can help us identify and resolve those gaps. As to the data sources, the TANF numbers of participants, those all come from our automated client eligibility system database. And if I'm not mistaken, it's probably noted in the LIFT report, but I'm pretty sure the poverty level numbers come from census data.
Thank you. That's all I have, Mr. Chair.
Thank you. Okay. Molly, a question for you procedurally. One of the points of getting this report out and circulated was to try and find ways to make it more readable, useful, accessible for those of us who don't live in this world. Is it probably best to just email you with suggestions based on, as we go along, as we think about them, for how to make this read better or be more helpful to us?
Yeah, absolutely. I'm taking some notes here, and there's also much more context and different visualizations of the data in the report that may be helpful, but either here or anytime you want to follow up with me about this or frankly anything else that we can be doing better, don't hesitate.
So I encourage the committee members, as they read through this report and we worked through this morning, if you can think of ways that would make this information more accessible to you and to others, I'd encourage you to get in touch with Molly. I have a couple suggestions. I'll be in touch. So, all right. Can we go to the next slide? All right. Are there questions related to this? The format's starting to look familiar. Any questions for folks? I'm not seeing any. If you go ahead, Molly. And that's much the same. Again, no questions. Okay.
Mr. Chair?
Yes, please, Representative Zager.
Thank you, sir. I just want to confirm, it's my understanding that if somebody qualifies for SNAP benefits, that they are automatically eligible for WIC, the Women, Infants, and Children Program. Is that correct?
Well, they might be eligible for the program based on similar income standards, but they still have to go through the WIC application process, which is handled by the CDC, which is a peer office within our department. So it isn't an automatic sign up for WIC. We often collaborate with our WIC partners to ensure that there's awareness about the WIC program, and we often will link people to take advantage of the WIC services when we see that there's an opportunity to refer someone.
Thank you.
I would just add too, I think that that the distinct difference around the assumption of eligibility here is the age group. So not all SNAP households have children who are age eligible for WIC. I just wanted to point that out.
Okay, thank you. Senator Baldacci?
Thank you, Senator Claxton. I just wanted to ask on a rule, the new program that provides a monthly benefit to families with children, is it part of that federal rule, or do we have a state rule that excludes that as countable income so people can continue qualifying for these programs and still receive that without, I just want to make sure that that program doesn't factor into these programs as countable income.
Senator, are you referring to the pandemic?
No, I meant well,
Chuck.
it's part of the federal it was like, it's right now a temporary program for 1 year, but they pay $250 to $300 per child.
Tony, I know what the senator is talking
Okay,
about.
all right, yep.
It's the child tax credit, the
Yes.
CTC. So, and answers to answer your question, Senator, those credits are not counted in the
Okay.
public assistance programs for the most part that I am aware of. Tony, correct me if I'm wrong, but I'm pretty sure they're not. And I just want to add just a plug in here for CTC and the work that the department is doing with various advocacy agencies and our federal partners. I think we all are aware that this has this is a huge opportunity to impact child poverty in our state and across the country. So we are getting out that message and partnering with various agencies like WIC and Maine Care and DOL, just to really get the word out, because there are families that are eligible for this program, even if they don't have earnings. And so they may not be taking advantage of it. So
Okay.
we're very aware of that and are doing everything we can to promote access to that benefit.
Well, thank you very much. I appreciate that.
Representative Lemelin.
Thank you, Senator. I have two questions, if I may. The first one is, did I hear you say that WIC goes through the CDC?
Yes, CDC.
Why?
Well,
I could jump in here a little bit, Tony. Sorry, I don't want to overstep you, but I think, so there's a lot of nutrition components with the WIC program and assessments and appointments, health appointments. The child has to be seen on a periodic basis. They have to be weighed. There are other health screenings that the WIC agencies or the WIC providers do in the communities. And so that's primarily why that program lies with the public health department.
Okay, that's confusing to me and others because I don't see the correlation at all between nutrition and the CDC. So if somebody could get me more information on that, I'd greatly appreciate it. The second thing is with all these graphs, at first glance, these graphs make you say, wow. However, Mr. Pilot, you said that there are circumstances like parents who don't want to give out certain information of another spouse or their companion or whatever you call it today. How do we get a graph that has the other 20 components? So how can I see a graph instead of seeing 2 components and it makes it look like we're failing miserably? How do we get a graph with 20 components on it that includes all those other variables? So then now we can see the gist of what's really happening and make an assessment here. Thank you.
Yeah, I think that's what we're starting here, is where this is just the baseline of information that we're beginning with for LIFT, and we're looking for feedback from the committee to help us identify other data points that can help pull out some of the other things that provide a more full picture of the need. You know, there are requirements for the program, not just income requirements, but TANF in particular. There are other requirements and things that households need to meet when they're on the program, and that is a possible area where it's preventing or it discourages some people from applying for the program. So I think that's one area that, how do we get at that information? Like, how do we know for sure that that's what the reason is for that family to not avail themselves of the TANF program?
And I want to echo what Representative Lemelin had asked before. I think to the degree to which we can break out the why there's the gap, and understanding that one of the major categories is going to be family refused or opted out, some neutral language. I think it would help to know what percentage timed out, what percentage opted out, and any other things that we can reliably obtain would help us understand where the barriers are, as opposed to it looks like we're not doing as good a job as we'd like to. So I would echo what Representative Lemelin just asked, and see in the future iterations if we couldn't get a layer deeper or so on the whys. Representative Zager?
Thank you, Mr. Chair. There was just some confusion earlier in this discussion about why the CDC would be involved in nutrition programs. I think it's important for the committee to remember that although many people associate the CDC with infectious disease, there are a whole lot, that's actually a small one component of all the diseases that the CDC is charged with minimizing to ensure the health of all Mainers. Nutrition-based diseases are a huge part of what the burden of human disease is.
And to follow up on what Representative Lemelin said, I'd like to know if all of the WIC programs in the country fall under state CDCs. That might be an interesting factoid to help us in terms of sorting out options. But I understand what you're saying, Representative Zager. Okay, can we go to the next slide? I don't see any other hands up. This is the one I struggled with the most. Representative Pilat, can you, Director Pilat, can you tell me where the 4,739 total comes from in terms of all terminations? That number is fixed across the year. Is that the total number of families?
That is correct. And what we're trying to show here is the same group of people over a quarterly basis. So that's why the numbers for both are fixed.
Okay.
So we're just basically tracking them for a 9-month period here.
And that's the number of people who were terminated is the total. And the number who had no income is the other number?
Right. You've got that right. That's the percentage that works out.
Okay.
Here.
So, and your interpretation.
So 2,516 families, no income out of 4,739 is how we're deriving the percentage.
Okay, and it's a crude summary, but you said basically from this graph, it looks like people are stuck where they are and not progressing the way we would hope. Is that a fair summary of what you said?
That's fair. I would just add that there are other income sources to many of these households.
Yes, yes. No, I don't want to minimize those. And I know there's SSI and SDI, things like that. Okay. All right. I don't see any questions on this stuff. So if we can go to the next graph.
Senator Claxton.
Yes, Representative Meyer.
Thank you, Mr. Chair. Just going back to that. So other income sources, I'm interested to know a little bit more about that, because it looks like in 2019 that nearly half, about 46% of the families for whom TANF cash assistance terminated had no quarterly earnings. So of those who did have earnings, some of the information that I have received indicates that more than 2 in 3 of them were making poverty wages, meaning they were still living under the poverty line. So those alternative or other income sources. Could you just elaborate a little bit more on what we're thinking these folks are tapping into once they're terminated?
Well, I do think, I mean, again, this is just, we're starting out here with some baseline data for this report. And I think one of the things that I asked the team to consider going forward is a representation of that percentage. So if you look at 2019 and you look at the 46%, it'd be good to see how much of that 46% has other unearned income, like disability income in the household. You know, if we're looking at, 40%, that might change some of the approaches we would take for these families, as opposed to if it was 10%. So I do think there's a need for a little bit more data here to better understand what this all means for the LIFT effort and other policies that could be implemented to reach these families and better support them after they've come off the TANF program.
And just to build really briefly on what Director Pilot noted, just to be more specific about this data, it is data from the Department of Labor. So it shows what earnings through the Department of Labor is aware of, but to expand on what those other income sources that are not counted on, that could include child support income or alimony, SSI, SSDI, as we talked about, unemployment insurance, and other sources, and that would not be counted through DOL, so that those kinds of income are not included here.
And Molly, I would just add one additional source, and that's self-employment or out-of-state wages. We don't know where it's hard for us to track folks who, once they leave the program. We can access DOL's quarterly wage data, but we cannot get at self-employment, and we cannot identify out-of-state wages.
Representative Stover?
Along the same lines, I'm just curious if it's possible to look at when you do, I think Director Pilot said you're doing some work around this for LIFT, if we could break out in those numbers, which of those individuals that no longer receive TANF receive SSI or SSDI, and then just to sort, if you will, who's getting that other benefit and who isn't. And then for those that are not getting, that we don't know what they're getting, they may be getting little to nothing if they don't have other sources like out-of-state employment or some other source. So I just think there's a concern about the number of people, not knowing how many of them are known to have SSI or SSDI. And if we could look at that broken out a little further, if it's possible.
Thank you. Other questions before we go on to the next slide, Molly? So folks comfortable with the educational levels? All right, and the next one is similar. Any questions about that? Representative Meyer?
Thank you, Mr. Chair. So the report is showing that the educational characteristics of people leaving TANF are virtually the same as those on TANF, meaning Aspire didn't help them to access education or training resources to increase their earning capacity. Do I have that right?
I don't know. How are you drawing that conclusion from the data? I mean, what I'm drawing from this is that, education, employment, and our training programs, are very critical, but I'm not drawing the line that you are from, like they didn't change their education status while they were on the TANF program.
So are we finding then that those folks coming off TANF, do we have data to support that they have been well served by the program in that they have participated in education or training that positions them for good paying jobs in our workforce?
I do think there is data that could be gathered to show that there is a wide array of outcomes for families that are on the TANF program and then transition off. So some would show that they attained higher education or training that positioned them well for employment options, and there's some where it would show that they didn't, and some of that is by choice.
Can I just add a couple of things, Representative Meyer, to your points? So the Aspire program is meant to serve, and you're probably well aware, families in a wide variety of ways to skill them up so that they can be competitive in the workforce, either through job skill activities or training and education. And sometimes we see folks who want to become move quickly into the workforce. And so there's an effort to focus on what it is that they need for barrier remediation in order to do that. And then there are folks that would like to obtain higher education. And so we try to meet people where they're at and honor their goals and objectives. So there's that component to it. I don't think there's anybody that would disagree that somebody with higher education or higher credentialing has a better opportunity to move into a sustainable living wage job. But I just wanted to make sure that folks understood that our participants do get the opportunity to kind of choose their career paths or their goals. And we try to do the best that we can to prepare them so that when they do leave, they are in a better place. Now, that doesn't say that always happens, that there are things that come after folks leave the program, or maybe they weren't as prepared as they thought they were. So it impacts their ability to earn those livable, sustainable wages. But that's what the program is designed to do, theoretically, is to get them in a better place.
Yeah, and just again, back to the data point, I think I just want to make sure that we understand that over this 4-year period, this is a rolling number, and people come onto the program and exit the program. So someone who is in the high school equivalency count for 2016, it may be that they end up in, the green category count for 2017, and then possibly in the purple when they end up off the program in 2019. So there is kind of this movement that we're not able to yet represent with this chart. So I wanted to speak to your major concern, I think, with this particular data point.
Thank you.
So it sounds like we need to consider some other better way to capture what Representative Meyer was talking about. So that's an important point, that this is not a static population over time, and you're not tracking X number of people over 4 years. You're tracking different populations over 4 years.
That's accurate.
Thank you. Representative Madigan. When you're unmuted.
Thank you. So I just want to thank you, Mr. Chair. And I guess I would like more information. I had a similar question to Representative Meyer. So what I think I heard both Ms. Ham and Mr. Pilat say is that that there is some data, perhaps not in this report, that might show if educational attainment has changed. I mean, so is there a data point that available that would show us what someone's educational attainment was when the parent guardian first entered the TANF program, the family, and when they ended? I mean, I think that's really important. I think that's more useful than this, actually. And is there any data as far as what the breakdown is of what educational attainment people got? I mean, I'm just thinking of workforce challenges we have in the state, things like plumbers, things like, I don't know if you've tried to find one recently, it's kind of difficult. I mean, there's plenty of educated professionals we need. And it seems to me that the support of programs like Aspire or programs as Parents of Scholars, things like that, could really help people enter the workforce for some really jobs in high demand that would pay really well. So they would never have to have any of these services again. And they could, go on and live their lives as a nice middle-class family and do whatever it is they want to do.
And I do, just to that point, Representative, there is a chart in the report that shows the educational attainment levels of families 1 year after termination, or parent participants. And so I think that was what Representative Meyer was comparing to. And as Director Pilat noted at the beginning, we sort of chose a selection because we would be here all day had we gone through every every chart and table in the report. But I think too, to Tony's point, those charts are based on families by year and not tracking individual families. And so it's hard to say that the same family that joined in 2016 had been off in 2018, and therefore we can tell you exactly whether or not X number of families in that year increased their educational attainment through Aspire. So I think there's work that we can do to more directly respond to your question, but I did want to note that in the report there is another chart that outlines the same data point, but for families 1 year after their benefits have ended.
What you're talking about to get the answer to the question would be a cohort study, and that's a lot more labor intensive likely than summative data.
Right, I'm asking for, like a pre and post testing. This is
Right.
what it was before.
Right.
And
You're
then
looking
when,
for-
at some point and then at termination, kind of what's the educational attainment?
You're
It's
looking
asking
for
different questions.
study data, and the other problem is that the people who are successful in the process, they drop off the list. If you've gotten your additional certification and now have a good job and no longer qualify for TANF, you drop off. So there's a constant rolling increment of people who are coming on TANF who do meet the requirements. So
Right,
interesting
but I
challenge.
think we should be noticing that, that we should.
Oh, I
that should
agree.
be some data.
I
And
agree.
it
It's
also-
hard to do.
Just like one follow-up question about that. Do we have any information about just educational programs that are, or professions that are in high demand? Is there any information about outreach to TANF recipient families? Just, I mean, community colleges, for instance, offer a number of programs. And I've worked with a number of individuals who are in the TANF program, adults, parents, who participate, who try to go to community college, and, they get some supports. And it just seems to me that that's a lifeline for many, and that it takes a lot of encouragement in helping someone go through that process. They're already, likely if they're a family living in poverty, they're already pretty stressed. Adding in school and things like that, supporting them. I'm wondering kind of if we have any outreach, how are we measuring that at all?
Yeah, I don't know, Tony or Beth, if this is a good time to talk a little bit about the HOPE program and Parents of Scholars.
If we're doing it later on, I understand we may do it in detail later, but just.
Okay.
Yep, I do think that we are going to talk about, we're going to talk about that in more detail later. So if you want to keep this moving, when we get to that
Yeah,
section,
that's fine.
Representative, okay, sure.
Thank you. So you put your hand down, Representative Meyer, so you're willing to wait for a little bit and see what transpires?
I am, Mr. Chair. Thank you.
Thank you. Okay, Molly, the next slide. Okay, any questions about these? I'm not seeing any. We have a significant disabled group that's pretty static. Is that one way to interpret some of the data on there? Okay. Okay, next slide then. Oh, and that's the monthly versus yearly enrollment, right?
That's correct.
Yep. Okay. All right, so I think that was the last, was that the last of the slides? Before we got to the, what we're doing with this information portion? Oh, that was the processing time, yeah. Yeah, that would be a general comment I'd make. It'd be nice to have some national metrics where we fit in the scheme of things, understanding that how Maine does this process is different than how Montana and Wyoming and Colorado all do it. If we can figure out some way that gives us a comparator about whether we're getting better over time, that would be a good thing, but not part of this conversation. Representative Meyer.
Thank you, Mr. Chair. Just going back to the TANF main care participation slide, you don't have to go back to it. My quick question is, wouldn't everyone receiving TANF also be eligible for main care?
Yes, if that's what they opt into. We don't just automatically sign somebody up for a program. So if somebody comes in and says, I'm looking for TANF assistance, our eligibility staff would say, you're also eligible for main care assistance and SNAP. And they would discuss the program with the individual. And if the individual was interested in the programs, then we would sign them up at the same time.
So best practice is that the eligibility specialist is providing the individual they're applying for TANF or whatever else they may be applying for with the full range of what they may also qualify for?
That's correct. That's how they're trained. So obviously we have our three main programs. We have the food assistance program, SNAP. We have the cash program, which is TANF, and then we have medical assistance. And then we have some other smaller programs that we administer under each of those major programs. But when somebody comes in to apply, generally speaking, folks are coming in and they know what they're looking for assistance. But there are some folks that will come in and they'll just check one of the application boxes, like, I just need help with food. Well, they may also have very little income. They have no health coverage. So our eligibility specialist would say, there's also this cash program, TANF, and here's what it entails and what it can offer you and your family. And here's, medical assistance, main care, and what we call it in Maine, and here's what it could offer to you and your family. Now, obviously, you have some individuals that they have no children, so they wouldn't be eligible for TANF, and also the eligibility specialist is trained to recognize the different household composition and eligibility for these programs. So hopefully I answered your question a little bit, but they are trained to kind of triage the situation and then offer these other programs if they haven't already opted at the beginning of the process.
And I know, thank you. And I know that I know that the working group report takes a deep dive into My Maine Connection and makes recommendations as to how to improve our online system. But does the current online system also speak to someone who's on it about what else may be available to them?
It does in a couple of different ways. So there's and then there's multiple systems. So happy to talk about all of them if you like, but we do have this online application and recertification process called My Main Connection. And when someone applies through that, they have the ability to opt in or opt out of any of those programs. They can also do a pre-screener that gives them a general sense if they might be eligible for these programs before they go through the application process. And then once that information is passed over to the other eligibility system, this is where we verify the information that's been provided and calculate eligibility and what the payments might be for each of the benefits. There is also at the end of that process. So online, they have kind of the screener process. And then once it is in front of an eligibility specialist who's processing that online application, they have the training to recognize the potential for someone's eligibility for other programs that they didn't sign up for. And then lastly, at the end of the eligibility determination process, the second system, there's also a flag that will come up for the eligibility specialist that says, hey, did you offer this individual main care? Because it looks like they're eligible. Mm-hmm. So there's multiple checks and balances throughout the application process that allows us to ensure that we're offering the maximum benefit possible for that household. Sorry, that's a lot of, yeah.
That's a helpful piece of information, because what it implies is that somewhere locked away in the database is the ability to answer the question, were these people offered all of these resources and opted out? So maybe we can go a little deeper on that in future reports, but that's important tracking. Okay. Yes, Representative Zager.
Thank you, Mr. Chair. Just to kind of follow on, I appreciate the diligence of the enrollment specialist that Director Pila that you just described, and I would furthermore be interested if people are declining coverage that they might be eligible, that they apparently are eligible for main care. It would be good to know that they have health insurance coverage some other way. I don't know how simple that would be to collect with current systems. If the interface that the enrollment specialist has can input that. I also am aware of the burden of inputting data while you're trying to have a conversation with the person. But I think whether they have coverage through main care that they're eligible for is a very, very important question. Senator Claxton just pointed out, but also if not, then do they have some other form of coverage?
Yeah, I mean, just very briefly, because it's somewhat a little more complicated, but there is third-party liability data that we collect. So I guess I'll leave it at that. But generally, that's a question we ask if someone's applying for main care, if they already have another coverage option, and of course in they're able to carry both. There's just an order in which the billing occurs, and billing and claims and all of that happens at another office within our department, which would be the Office of Main Care Services.
Okay. So I think we can go, if this is the last slide, did you want to talk at all about what the department's done with this information?
There's one more if there are questions here, and then we can certainly pivot to the policy conversation.
Obviously, things are better there, so on average. Thank you. Yes, Representative Meyer.
Yeah, quick question. So does this reflect the wait time to get to a person at the call center, or does it reflect the wait time to get to the eligibility specialist that can answer their specific question?
Yes, that's a very good question. So the approach prior to the call center was everybody that was calling would need to wait for an eligibility specialist to answer their questions. And then the thought arrived at, well, what are the general questions that we are getting from callers? Because if a caller is really just trying to find out what the status of their application is, we do not need an eligibility specialist to take 10 minutes or whatever to address that question. What we want to save the eligibility specialist for is processing of application questions, eligibility requirement questions. So the idea of establishing this call center, which with support from the legislature for those positions, thank you very much, has allowed us to address many of the low touch questions that a lot of our clients have. So this is representing, instead of an overall wait time for everybody to speak to an eligibility specialist, what it now represents is most people are able to get their questions answered at that reduced wait time. Everybody else that calls the call center and says, I don't understand this particular requirement for the program. The call center then says, I need to transfer you to an eligibility specialist to answer your questions. Did that answer your question, Representative Meyer? Or?
It does. Do we know what the wait time is to get that call back or call to the eligibility specialist and answer those more specific questions?
I can hazard a average. I think it's around 26 minutes or so. Now, of course, you're going to have outliers. Some will get through faster and some will be waiting much longer to speak to an eligibility specialist. There's a lot of factors to that. Some times of the month are much busier for eligibility specialists. For example, our issuance days in Maine for SNAP are the 10th through the 14th, and we issue partial benefits out on those days. So if somebody doesn't get their benefit available, or they aren't able to access their benefits on that issuance day, they're going to call and ask to speak to an eligibility specialist, which bumps up the volume and our ability to take those calls quickly.
Thank you.
Yes, Representative Perry.
Yeah, thank you. I'm just looking at the trends here, and I'm seeing a real downward, which is good in terms of weight in June of 2019. And is there a specific policy or change that was made to allow that to happen?
Thank you. Yes, that's when we started this call center idea of dividing the types of calls that could be taken by those that are not eligibility specialists. So, yep, go ahead.
Which is because I'm also looking at the uptick in the 20, which is obvious because of the COVID. But now we're seeing in June that there was a real downtick in the waiting area. Are you finding that as a result of the different types of calls, or again, a policy change?
Yeah, it's very interesting that, to see the number spike like that because of the pandemic. Of course, we started moving towards more distancing because of the pandemic. So of course, we increased our call volume. And then as that particular year progressed, we certainly took advantage of different waivers that were available from the feds to allow us to provide a greater level of service over the telephone or online without having to have that face-to-face interaction. So what I think we're seeing here in June is this was shortly around the time when we started changing our state policy on, being able for people to be able to come into the office. And so we have seen, which isn't represented here, but we have seen over the last couple of months a slow increase in intake where people want to come into the offices and they want to speak to individuals in person. So I think that's what we're seeing here.
Representative Stover.
Thank you, Director Pilot. I just had a quick question based on what you just said. Would you show some efficiency in the call center response time? Would you agree that despite that, there's really not been a significant change in getting specific program questions answered by, for instance, an eligibility specialist? Like the call center's answering within that short period of time. What about the answer time for the questions that someone might have?
Yeah, I think if I understand the question, is the amount of time, is it that the amount of time that someone spends with an eligibility specialist has decreased when they're actually on the phone with the eligibility specialist, or you're on mute, Representative?
I think it's an access question. How quickly can they get to the eligibility specialist? And you partially answered that with the 26 minutes that you shared with Representative Meyer. What we don't have is a baseline before that.
Right, previous years.
Yeah,
I'd have to, I think this is the line, right? I mean, I think the data here is challenging because prior to the call center, it was all eligibility specialists, right? And so as of June going forward, now we're saying we're only tracking the call center timeline, which shows the decrease. What you're asking for is perhaps a continuation line here that would run somewhat parallel to the new line from 2019 to show what the eligibility specialist wait time is.
Yeah,
I think that's what you're asking for. And I think that's certainly doable for a future iteration of this.
Did you have a follow-up question, Representative Stover? Okay, Representative Zager.
I think it was Chair. I guess the question that really, I would have is, what is the time to get the need met or the question answered? A lot of times that it sounds like you've identified that there's a pool of common questions that somebody who has less training than the eligibility specialist could answer. I don't see data here that supports that shows that the intervention, which has reduced the time for a person to speak to another human being, has decreased. But the reason they're calling, we don't know that need has been met, or the time that need is met, which kind of relates to the time to talk to an eligibility specialist. But even that datum doesn't tell us that the need has been met, or that they needed to talk to the eligibility specialist. They may or may not. I don't know if a VIA call manager has a automatic did we answer your need today kind of questionnaire that I sometimes get when I call some other call center. But if that data is relatively easily retrievable, I think that's the key variable that we want to reduce barriers, not put up more barriers that we can then measure it takes less time to reach.
Yeah, I completely agree that, we're certainly not all the way where we want to be as a shared goal for telephony services. I would say that I do think that the data shows that we're helping a population that was otherwise having to wait, a significant amount of time to get their status, where's my application status question answered. So there's a number of the population that are being helped significantly faster because of the call center, because now we've kind of triaged their questions and they can get a faster response from that call center. But it's certainly a fair point to ask, how much better are we doing with those calls that have to go to the eligibility specialist? And the challenge there for us is those questions can vary. If somebody's, talking to an eligibility specialist because they're working on an application where they're applying for all of our benefits versus someone who just needs to recertify, which is a shorter process, those processing times with an eligibility specialist can vary greatly. It could be 15 minutes to process a recertification, and sometimes it could be up to an hour where they have to talk on the telephone with the eligibility specialist to process an all benefits application. So there's definitely some work there. Love the idea of like a post-call survey option for individuals to say, did you get your call successfully handled today? I think that's a great idea.
I appreciate the complexity and the work that you and your folks are putting into it.
Okay, we back? Okay, all right. Thank you for all that help with interpreting the data, Director Pilot.
Thank you.
Would you like us to jump into the
Sure.
discussion?
Yeah.
Great. So I think Tony is on deck to walk us through here. Just a note in the report, we do not include and in the future, in the discussion we're about to have, we don't include the COVID-19 policy changes because those are time limited or may have already expired. And this conversation is more about long-term sustainability and operation of the programs, but we did list a few of them here so that you're aware of them, and Tony can run you through a few of them. And we're happy to take questions. Just wanted to note that's why they're not included later in the presentation.
Yeah, thank you, Molly. I feel it was important, obviously, for this this significant event that we all been working through over the last year and a half to show some of the work that Family Independence has been doing with the department's support. There's been a lot of food programs and food benefits that we've provided to families. We've taken advantage of the federal opportunity to maximize household SNAP benefits. We've implemented a pandemic EBT benefits for those children who were in households that were learning either virtually or in some sort of hybrid situation. So that was additional food benefits to the household. We're doing a summer PEBT issuance in a couple of weeks, and there'll be another PEBT effort for the coming school year. So just a lot of work around ensuring that needy families have the food they need for themselves and their children. And then, of course, we've done some other things with the TANF program where certainly the pandemic is not conducive to some of the requirements for that program. So we've taken advantage of suspending some of those requirements to ensure that families don't feel that added pressure to put themselves in physical harm with the current virus situation. And then, of course, on the main care front, we, with obviously the federal guidance in place, we've not closed anybody off from main care services. We've monitored their cases. We've kept up to date with verifications and the latest information about those households, but there have not been any closures on main care due to household circumstance changes. I think the only exception would be, of course, if someone left the state or has passed away. So a lot of things that OFI has done to ensure families are supported through the pandemic. So I guess that's all I'll say about this particular slide, unless folks have any questions about these policies. If not, we can move on to the next slide. Okay, so this particular slide is really just talking a bit about some of the recent policy changes that OFI has been undertaking, not related to COVID. So for example, we're listing the elimination of the full family sanction. Some of you may have been involved or aware of this change, but essentially what this does is it does not, if someone doesn't comply with the work requirements for TANF, we're no longer closing the entire household's benefit. We're only reducing the benefit by that individual's allotment. So that's one recent change that we've been undertaking on the TANF program. We've also, for example, implemented some whole family service contracts across the state. 11, this applies a 2-gen approach where we're working with families to help them break this cycle of poverty. So I think that's been an important measure that those contracts just got encumbered within the last month, and there's a lot of good work going on that front. We've also updated program rules around TANF extensions, and the lifetime limit are currently being drafted. So I think that's something for everyone to look forward to. And then lastly, just to summarize, the data on this slide is a mention of the higher opportunity for pathways to employment. This has been we're now into the second year of the program. We have over 350 individuals currently enrolled in HOPE and have had many success stories where people have completed credit programs or degree programs, many of them in the health service field. So thank you for your support with the HOPE program. And Beth, I don't know if you want to add a little bit to HOPE, because I know how instrumental you were in putting that program together.
I think I'll just harken back to some of the questions we had early on what are we sort of doing in the department to move people into higher ed opportunities. And so HOPE is for families or adults with minor children who are not on the TANF program. And so these families, if they have a desire to want to improve their skills or obtain higher education, the HOPE program provides them with an opportunity to help them with a variety of supports, such as childcare, payment of tuition if they need it, payment of books, transportation. It also provides a service, a navigator service, to help them navigate the college experience or the credentialing experience, as well as barrier remediation. And as Tony said, we've seen a tremendous amount of success with this program. And I was very fortunate to work with the former speaker, Sarah Gideon, to move this initiative forward through legislation. And I am proud to say that I was able to show her a story that resulted from an interview with a participant in Hope on WMTW a week or so ago. And it's just great to see this program thrive, but mainly to see the families thrive as a result of it. So something that the department is very proud of.
Representative Madigan. You're still on mute, Representative.
There we go.
There you go.
So the HOPE program is for families who are not involved in TANF, but are involved with the department in other ways, so that if someone, or is that anyone?
It can be anyone, Representative, anyone with incomes under 185% of the federal poverty level. And Tony can check me on that if I have misspoken. Yes, so they can be involved with the department, certainly if they're on SNAP, but not on TANF. This is a program that they can take advantage of if they so choose. But any family with minor children that meets those income criteria can participate in HOPE.
So my next question would be, thank you, would be, you mentioned navigators within the HOPE program. And that sounds like a great idea. We know how important navigators can be in obtaining housing or other things, or getting involved in completing education. I'm just wondering, is that something that's also available to families or to adults who are participating in the Parents of Scholars program? Because it seems to me there's a lot more families involved in the HOPE program than there are in Parents of Scholars.
I believe if it isn't currently, it will be. And Tony, you can expand upon that if you have more detail on that in that regard.
Yeah, I guess what I would say is that it's not currently in place for Parents of Scholars, but it is something that we've recognized as a successful piece of HOPE and something that we're looking to employ with PASS.
Thank you.
Representative Meyer.
Thank you, Mr. Chair. So we've got a program cap of 800 students in HOPE. What is the program cap for Parents of Scholars?
I'm not aware of a specific number cap for PASS.
How many are currently participating
In the PASS program?
Mhm.
I think the last time I looked, it was definitely under 100.
Under 100. This committee, right around the time we were hearing the LIFT legislation, heard from a number of students involved in Parents of Scholars and graduates, compelling testimony from people who had literally been lifted out of poverty by that program. We have so many areas of our workforce that are screaming for educated professionals to enter their ranks. Are we using the Parents of Scholars program to help those folks and those industries find one another?
So I'll start, Representative Meyer. So the answer to your first question around how many participants can be enrolled in PASS is 2,000. And so falling well short of that cap, as you pointed out, what I would say is that the department needs to do a better job at navigating families towards educational opportunities. So we hear we hear your concern there and certainly agree that there are sectors of employment out there where our participants could benefit and be able to live and sustain themselves and be self-sufficient. So I think the challenging, or at least the inquisitive part of myself, when you look at the participation in the HOPE program and how we have seen an uptick in participation in that, which basically provides much of the same similar services as the PASS program, it makes you wonder, why are we not seeing a similar type of trajectory and enrollment in the PASS program? And so I think there are a couple of reasons why, and this isn't to, there could be, when we see families that come onto our TANF programs, they're in crisis most generally, and sometimes it really does take some time to get them to a place where they can participate in higher educational opportunities. Now that's where I think we need to focus within the department as to, are we really moving them in that direction if that is what they want to do? And I just want to make sure that I say that, because there are families that want to go directly into the workforce, but are we doing our due diligence in making sure that we are promoting this opportunity to our families in a way where they can really appreciate it? And the one thing I would just say for background, and I think, you know, my fellow friends and advocates, whether they're at Maine Equal Justice or Center for Budget and Policy Priorities, the TANF program inherently was developed in a way where it is process oriented and administratively it's a program that really just tracks compliance, I guess, if you will. And that is fundamentally not the way to move families out of poverty. And I can say that openly because I've had conversations with federal partners and on both sides of the aisle. And we know that fundamentally the TANF program is built on compliance and process and tracking that, but does not track outcomes. And that's where the program eventually needs to go. And TANF, and I think so, as it's been embedded since 1996 in welfare reform, many states have taken different approaches to move away from that within the regulatory authority. And Maine is going to be doing the very same thing. And I know that I could go on about this, but I'm going to stop because we're running over. But I just wanted to recognize that.
Thank you. Representative Madigan?
Thank you. Thank you, Ms. Ham. I agree that we need to be focused on outcomes. As far as I know, there's nothing in the 1996 Welfare Reform Act that prevents us from taking a more outcome-based approach, correct?
Well, there are yes and no. I will say that. I think that there are work participation rate requirements which drive the activities that the TANF program kind of is built upon, which is where I was saying it's these activities, but are they meaningful activities? They may count towards work participation, but they're not activities that may lead someone to better economic stability. And that's where we're taking a look at our opportunities with assistance from national experts on how we can both be in compliance with the law, but recognize that maybe we don't have to chase all of those or make our families do all of those less meaningful activities that really don't get them in a better place or even skilled up, and how we can take advantage of the fact that we are meeting work participation rates. So that's a larger discussion and one I'm happy to have at another time, but we are moving there.
Thank you. We'd love to have that discussion too.
At another time. Okay. Next slide.
So this next slide is really just showing some, like the TANF slide that preceded, just some different things that we've done with SNAP. We've implemented online purchasing option. That was a significant help to many. We've made some asset limit changes. This makes it less burdensome for our older and disabled populations to get on and stay on the SNAP program. And then obviously the EBT card changes over the last couple of years to transition away from a EBT photo aspect on those cards. If any folks have questions about this particular slide.
Doesn't look like it.
And then the next one is just some important changes on the main care front. Obviously, main care expansion. You can see there's been a lot of people helped by the expansion of main care. We've made some recent improvements to our presumptive eligibility, which is really folks looking for, they go into a hospital or family planning situation, for example, and either the hospital or the family planning group would make an initial assessment about someone's eligibility for main care, and that helps get people into main care more quickly and get the services they need more quickly. We've also made some changes to estate recovery, which are beneficial for folks. Any questions on this particular slide or?
I'm not seeing any.
Okay, and then some interesting items we have going on here. They call it a benefits cliff calculator, but there's a couple of efforts underway. One in particular that's very promising is this Federal Reserve Bank of Atlanta. It's a calculator that is used to help people kind of plan out the future of their economic stability and opportunity. And this is a tool that is used by staff that would work for me or other folks in the department that could be used to help with planning of outcomes for individuals. There's
Tony,
go ahead.
Can I just add to that just real quickly, and that for the benefit of the legislators here, there is also a portion of this tool, and Connecticut is one of the first states to launch this in collaboration with the legislative body. And they're using this tool to provide or to see a view into the public returns to moving people up the career pathway. So the net taxpayer savings in career advancement. So this tool will actually be something that you all will be able to benefit from as well.
Thanks, Beth. And then a couple other things on this particular slide. The impact evaluation, which some of you may be familiar with, is an important independent look at the LIFT legislation and our HOPE program and either successes or areas where we can improve. So I think that in conjunction with these discussions will be really helpful for OFI and the department on how we move forward. And then of course we have probably, as our federal SNAP partners have acknowledged, Maine probably has the #1 training program for eligibility specialists in the country. So I just thought I'd share that little nugget of information that was shared with me a couple weeks ago from again, our federal partners. We put in a significant amount of training effort for all of our eligibility specialists. Both new hires go through, it's probably around 14 weeks of training, both curriculum-based, policy education, systems training, and then they also have learning at work sessions where they learn about the dynamics of being in the office and intake. We also, and I think there's a slide that will speak to this other program, we've implemented a culture of respect and empathy training curriculum, which has been adopted outside of OFI within the department. We'll talk a little bit more about that, but we put a significant amount of effort into making sure that our staff are trained well on policy and programs, our systems, and also have a level of customer service that we all would expect from folks who are working with our clients. So anyways, any questions about any of these items on this particular slide? I'm happy to talk more about any of this.
Not seeing any.
Okay, and then the next slide really is just some upcoming items of note that we'll be working on here at OFI. Here's the PASS reference. I knew we talked about it recently. So here's the Navigator tie-in to PASS services. As I had mentioned in one of the earliest slides as well, we have those whole family services contracts that have been implemented, 11 total across the state. We'll be looking for some early returns on how those are providing that extra level of wraparound services to families that are in need. And of course, we have a huge technology effort underway to replace our My Main Connection online tool. We talked briefly about that earlier. I think there'll be some significant improvements technologically for clients once this new technology solutions out in production. I think, unless there's questions, I think we've reached our first questions break.
Yeah. So I think we've had a chance for the committee members to ask questions. I think now it becomes an opportunity for folks who have been hanging in there listening to us for them to make some comments. So before we go to a discussion of the work group report, let's hear from some of the folks in the waiting room, as we refer to it. So I'm going to move Lacey Sawyer into a conversation, and then we'll probably go alphabetically for a bit. We've had some requests about who goes first and who goes last, and I want to try and respect those. So welcome, Lacey Sawyer. I see your name and I see that you're still muted. Did you have some comments you wanted to share with the committee?
Yes,
Welcome.
sorry.
Welcome.
Hello, thank you, Senator Claxton, Representative Meyer, and members of Health and Human Services Committee. My name is Lacey Sawyer. I live in Portland, Maine, and I'm an Aroostook County native. Shout out to Representative Meyer for excellent questions and follow up to the data that was presented. I really appreciated that conversation. For as long as I can remember, I've wanted to thank the Department of Health and Human Services for the opportunities afforded to me, because without TANF and Aspire, parents as scholars, I would not be where I am today. I'm a licensed clinical social worker, a licensed alcohol and drug counselor, and a certified clinical supervisor. Along with those programs, I relied a lot on my personal character traits, self-determination, perseverance, problem solving, and survival. My mom was an undying support and also operated from a place of fear, reluctance, discouragement when I went to college. It just isn't what our family did. We worked at the mill. I was expected to go to the mill like the rest of the family. I wanted to be a lawyer and I was called to social work instead. It wasn't until I was finishing up my bachelor's degree that I realized the adversities I was up against since birth. I was born into a family with generational patterns of substance use disorder and mental illness, both sides of the family. My father was and still is in active addiction. I grew up in a school bus with no running water or toilet. We bathed in a tin wash basin, had an outdoor bag shower, and heated with a wood stove. We melted snow in the winter and got water from the brook in the summer. And this was my normal, and I knew no different. After my dad left, my mom raised my older brother and I the best she could. She refused welfare because of the shame and stigma associated with these resources. I got straight A's in school. I was a perfectionist and overachiever. I was the first and only person in my immediate family to graduate high school. My mom graduated adult ed in 2000, the same year that I graduated high school. When I was 19, I had my son with my high school sweetheart, who also did not finish high school. I went on to the University of Maine at Presque Isle, and I remember sitting in the registrar's office and the woman asking me, "What would you like to declare for a major?" And I answered, "What's a major?" And somehow I still found my way. Programs that helped me the most were TANF, food stamps, WIC, rent refund, fuel assistance, Aspire, Parents as Scholars. Without mileage reimbursement, funds for childcare, funds for textbooks, vehicle repairs, office clothing, etc., I wouldn't be where I am today. But those things were still not enough. Section 8 housing lists were 3 years long at that time, 20 years ago. I took out extra student loans to live off of while taking classes year round, supplemented my income at times by landscaping and painting. But every time I took a job, benefits would change. I would have to be reassessed, prove my worthiness, volunteer if I couldn't find a job in time, so on and so forth. I was a 19-year-old kid trying to raise my own child and find my way through the red tape of the systems while barely scraping by. $363 a month in TANF for a family too was never enough. It barely covered utilities, let alone rent, clothing, food when food stamps ran out, toiletries, back to school clothes, and any other unplanned expenses. I remember when I graduated with a bachelor's degree and still qualified for food stamps, cub care, daycare, and fuel assistance. I now have astronomical student loan debt, and that is the only way I could supplement my income enough to be able to survive and make it through the system and using these programs only with the help of student loan debt. Recommendations for change: fuel assistance appointments need to not be in the fall and winter when funds are needed, but in advance and deposited into accounts in August before heating is needed. I heated my home multiple times with the oven, and without credit, you're made to pay for fuel up front. And if you don't have money, you can't do that. And this was in 2008 when fuel oil was more than $4 a gallon during the Great Recession.
Lacey, can you wrap up your testimony?
Yep, I can send these recommendations for change to somebody else. My biggest recommendation for change would be to mimic a wraparound team for people involved in these programs, to provide an integrated, trauma-informed, comprehensive team, with the biggest component being financial advising and academic advising if they're in the Parents as Scholar program. Thank you for your time. Very much appreciated.
Thank you, and I apologize for interrupting, but there are many more folks who'd
Yes, that's okay.
like to share some feedback. We've welcomed Amberine Rana, if you'd like to go ahead and offer your testimony.
Yes,
Welcome.
hello. Good afternoon. Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Ambreen, and I today am joining you to present the testimony of a friend of mine, Susan Corrales, who lives in Vassalboro, Maine, and I'll be sharing that this testimony that she provided to me. My name is Susan Corrales, and I live in Vassalboro, Maine. I am a mother of 2 and a small business owner. I have been a participant in the TANF program, the FedCap program, and Parents of Scholars. I first started receiving TANF when I was 16 years old and 6 months pregnant. I worked hard to get through high school and went on to earn my bachelor's in just studies at the University of Maine in Augusta campus. I also have an associate's degree in criminal justice. Despite my education, I struggled to find a decent paying job after college. The most I was offered was $24,000 a year. I had to resign my full-time job in order to take care of my children. My first 3 weeks under FedCap, I had no childcare or income. I tried many times to get into the Parents of Scholars program, and even though I met all of the requirements, it wasn't until 18 months after starting with FedCap that I was accepted into the program. Going to school full-time and being a mother meant that I could not work a traditional job. In order to make ends meet, I have started my own small business selling clothes, art, and jewelry at craft shows and online. I was finally accepted into the Parents of Scholars program, which was meant to lift some of my financial burden, but it meant I had to spend a lot of my time going back and forth to FedCap to prove that I was eligible for benefits. I was required to go to the FedCap office, but had schoolwork to do that couldn't be done at FedCap. I was faced with the choice to risk sanctions and get schoolwork done, or not fulfill my responsibilities as a student. It was a lot to juggle with 2 kids, a full-time course load, and the extra requirements that come from accessing benefits my family needs to survive. But I stayed with it because this is important for my kids and for me to be independent. There was a summer when I was in school that I was without childcare, even though I went to the FedCap offices and signed an FCA that covered full-time childcare. There was a delay in getting my TANF extension that led to not getting any TANF on time in June. This meant that I was unable to pay my electricity bill, and I also didn't have money to buy textbooks that I needed for my summer classes. I ended up needing to drop 2 classes, which caused me to drop off the Parents of Scholars program. I ended up paying a neighbor with the little money that I had to watch my daughter so I could go to classes. And I went to the FedCap offices regularly to try to get the issue resolved and fix it. I've experienced TANF when it was administered through DHHS and when FedCap took over. In my experience with FedCap, I had over 5 workers. They would change without providing me any notice, and it created issues with communication, and lots of things fell through the cracks. I'm just going to end her statement by saying that Maine can do better. Please address some of the issues and break down the barriers that Maine families are witnessing, and we need a stronger safety net here in Maine. You can read Susan's full testimony because it has been submitted to the clerk. And I also want to end by saying that there are many people that wanted to be able to share their testimony here live, but weren't able to join the Zoom because of the timing, and their testimonies will be shared with the clerk as well. So I encourage you to read those as they come in. Thank you so much.
Thank you for bringing that to us. Next, we'll go to Bill Flagg.
Yes, my name is Bill Flagg. I'm Director of Community Relation Development for Cary Medical Center in Caribou. I've been in this position for 42 years. I'm also a member of the Board of Directors for the Worcester Council for Healthy Families for 25 years, having served as past board chairman. I'd like to thank Senator Claxton and Representative Myers and members of the Health and Human Services Committee for giving me the opportunity to speak with you today. I want to speak with you today in support of the recommendations for change and in the important delivery of critical services to low-income children and families in Maine. Worcester County is facing a devastating shortage of workers in virtually every sector. The ravages of COVID and opiate addiction has contributed to the problem, but the failure of our current system of vital services to children and poor families in poverty also are contributing to this crisis. As this report suggests, 1 in 4 children in poverty are assessing TANF, a program designed to help them. We must do better. We can by responding to the recommendations in the LIFT report. Job training and education are part of Aspire, which is again trying to get people out of poverty. The experiment with FedCap that's been attempted has been, in my view, a failure. I can speak to this personally because on 2 separate occasions working with FedCap, I have to listening to a few hours of the attributes of their program I never received a follow-up phone call and never was able to place a single one of their clients in one of the two nonprofit organizations I represented. There is so much in this report, but suffice it to say, we must act now on some of these recommendations to improve the lives of low-income families in Maine. I would say that as a hospital in Aroostook County, we are facing a devastating workforce shortage. And anything we can do through the Aspire program, which I think needs to be changed in order to help fulfill those needs. And these are entry-level positions that require low technical skill to begin. They're great upward mobility positions in that people getting into the hospital as a housekeeper, laundry worker, or food service worker often grow through the system. And I think that by working closely with the Aspire program, developing additional partnerships, we could be much improved. Thank you so much for the opportunity.
Thank you, Bill Fleck, for bringing that forward. Next, we'll hear from Heather Martin.
Hi, thank you, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Heather Martin. I'm speaking today on behalf of the Maine Association for the Education of Young Children. I also speak to you today as a success story of having been a child benefiting from programs like WIC and TANF. My mother raised 4 children and had to utilize social service opportunities while working full-time as an educational technician in our local public school. So I can attest to these social programs working when they are accessible. I am actually the education failure in my family. I only earned a bachelor's degree and earned over 1,000 hours in training in early childhood development, while my brothers have earned doctorates and master's degrees. So that's kind of the joke in my family, having been a family that once was living out of a car, and now we are 4 success stories in the state of Maine. And why I think my family is a success story is because we had access to these resources at our community level. We had the support of the community around us. Our physicians knew about resources. Our pastors, our school administrators knew about resources and connected our families to those resources. And I appreciate Bethany bringing up about how a welcoming culture and consistent access point is so important to families. A big piece of accessing services that we are speaking about today is that human element. It's that element of interaction, and it's that element of building a support system around families. Families need to feel listened to and empathized with in order to reduce the stigma of their hardships and trauma. I think sometimes we talk a lot about our systems, our phone call systems, our internet systems, but really bringing this piece back to the human elements through our caseworkers and who are those people that these families already trust and can help with those resources are really important in this piece. I also want to bring the child care subsidy program into part of this conversation. It's a necessary component for helping parents access job training, education, and employment, while also having that peace of mind that their child is being cared for in an educational, safe environment. We've had great improvements made to this program on behalf of OCFS over the last 2-3 years, including Maine being one of the first states to raise our subsidy reimbursement rates to 75% of the market rate. And recently, the department will be moving to raise rates to programs accepting children with disabilities who benefit from the subsidy program. So I think we are, increasing the value in this program. However, we still have that gap that we're seeing in TANF, in programs like TANF, Aspire, and WIC, that there's families not knowing they are eligible for this type of assistance. This assistance over the pandemic had been expanded to families who are essential workers. However, this year I met a public school educator, and she's a educated woman, single mother, and
30 seconds, Heather.
She never knew this program existed. And for 5 years, her daughter was bounced around to insufficient care. And all along, she could have been qualified for this program to have consistent, high quality care for her child. And that really affected her child's life. So I think access seems to be one of our biggest barriers. And I support efforts around increasing access for families so that all families who want and need these programs are eligible to receive those. Thank you.
Thank you for those suggestions. Before we go to the next testimony, I want to encourage the committee members over the next hour or so to take a break, move around, get some lunch, but we're going to keep going through the testimony since are about 40 something people who'd like to offer their input. So we won't be taking an official break, but keep moving, and I encourage you to keep moving too. So next we'll hear from Joni Sprague.
Hello, this is actually Katie Hughes. I'm filling in for Joni right now.
Great, go ahead.
Senator Claxton, Representative Mayor, and members of the Health and Human Services Committee. My name is Katie Hughes and I live in Waterville. I'm a family services coordinator with Educare Central Maine. I work directly with families who participate in the FedCap program. We've had many families lose childcare as a support because they are not able to meet the expectations put in place by their FedCap worker, or because they are not able to get a hold of their worker in a timely manner. I also feel that FedCap does not understand mental health or take it into consideration when working with families. If a family is not able to advocate for themselves, FedCap is not one to offer support. You have to ask for it. I worked with a family who did not have a high school diploma and asked to go back to school, but was then told by her worker that they don't support parents with getting their GED or high set. She then lost her childcare and then reached her 5-year TANF limit. I no longer work with her, but knew that the only support she had when she left our program was her housing choice voucher. She lives in a rural area with no transportation and battled with substance use recovery. I feel that FedCap is not a program that is meant for everyone. If you don't fit within their mold, you will not be successful. I am hopeful that we are able to find better ways to support Maine's families. I thank the committee for your time today.
And thank you for that testimony. Next, we're going to go to what's listed as Carolyn McNamara, but is being read by Kate Brennan along with some other folks who are there testifying. So I'd invite you to unmute whoever's going first from the Kate Brennan crew. You're still muted. There we go. That's a start. Welcome.
So much, Senator Claxton. Can you hear me okay?
We can. Yes.
Okay, great. So my name is Kate Brennan and I'm reading testimony from Carolyn McNamara, who's a family nurse practitioner, and she's seeing patients all day, so wasn't able to be here. So Carolyn works for Community Clinical Services in St. Mary's in Lewiston, but wants to be clear that she's submitting this testimony as an individual representing these institutions or her employer. So Carolyn said, I see patients of all ages and genders and races in a community clinical setting. I work in one of the poorest census tracts in Maine, and I am very concerned about the impact that poverty has had on my patients who face significant challenges to meeting their economic needs. I am writing to share my experiences as a PCP with the Aspire program. I have been working with Aspire since 2012. At that time, DHHS administered the program. I remember our local Aspire workers in Lewiston and how easy it was to work with the program. They were friendly, professional, and accessible. They knew the program. When Aspire was housed at DHHS, there was more of a culture of helping people and reducing barriers at that time. My experience with FedCap is that many FedCap workers don't have the experience that DHHS caseworkers were expected to have, and they don't know the law. They don't understand policies and procedures. They have been assigned to monitor and apply punishments and sanctions and reach FedCap's number goals to justify their existence. I have to prove to them as a PCP, for example, that the patient who has to be on bed rest for pregnancy needs to focus on her and her baby's health and cannot fulfill her contract at this time. Staff will tell FedCap that as their PCP, I will send a letter excusing her, but FedCap says we don't accept letters. Instead, they sent a huge packet to fill out. I think it was 20 pages. Another mother had a 2-year-old child who started to have seizures. The toddler needed to be monitored 24/7. She was told by FedCap that she could work from home with her 2-year-old in tow doing something remotely. She was also, we told her as her healthcare provider that if the seizure happens again, that her child needs to be treated immediately. FedCap told me, her and her child's PCP that the child's seizure probably will never happen again. The opinion of a client's medical provider is never enough. What I see is poor families are giving up on the program, giving up TANF support because of how dehumanizing and punitive the program has become. FedCap's model is not what a support program was meant to do. It was created to make sure the poorest among us have the supports they need to work or sustain their family if they can't work. Please demonstrate compassion for people's lives. Continuing a contract with FedCap will only hurt our economy and disrupt thousands of children's lives. Thank you so much for your time.
Thank you for bringing Kate's testimony to us. Next, we'll go to Lisa Black.
Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Lisa Black, and I live in Bangor, Maine. I am the director of Kennebec Valley Community College's TRIO Educational Opportunity Program. I do not represent KVCC or the Maine Community College system. Instead, I'm here today on my own time and of my own accord as a private citizen because I firmly believe in higher education as a pathway out of generational poverty. I would like to highlight 2 reforms I believe are necessary for Aspire to fulfill that mission. Unfortunately, the way FedCap currently administers Aspire works against student parents by imposing impossible strictures that make college success out of reach and assigning case management that does not provide relevant or effective support. These outcomes are supported by the data in the LIFT report, with more than 3 out of 4 people who moved off TANF not receiving education or training opportunities beyond high school. And in July of 2021, just 20 parents statewide were enrolled in Parents as Scholars. The expectation that Aspire recipients carry a full-time caseload, course load is particularly unrealistic. And I outline many examples of this in my full written testimony. Briefly, to qualify for Aspire, parents must be enrolled in academic programs that are rigorous by design. They are challenging even for students without family responsibilities and financial constraints to do. And crucially, these programs require far more study time than the 1 hour for each hour spent in class that Aspire currently allows for to achieve the minimum grades necessary to move forward in these specialized fields. Essentially, it sets them up to fail. A related barrier is the outsourced case management through FedCap that participants are subject to. Students routinely report that FedCap caseworkers have a tone of policing and not believing them that is demoralizing at best. I have observed this cookie cutter approach that ignores the needs of students with complicated lives on many occasions. The way the program is currently set up puts FedCap workers in the role of academic advisors when approving or denying participants' degree plans when they have no training as academic advisors. They routinely make recommendations that are simply not workable and without outside intervention from somebody like me, which most students don't have, it leads to dropout. My students also report that the workshops they can take through FedCap as an alternative to classes at the college are irrelevant to their lives and leave them feeling condescended to. All of this leads to dropout and more financial debt than when student parents started, and much less faith in themselves or the programs that we promise will lead them and their families out of poverty. Luckily, there are models in Maine that do work for supporting first-generation college students with low income. Maine's New Hope program, for example, provides individualized navigation services tailored to a participant's unique needs. And my own program also gets excellent results with an individualized approach. So basically, thank you for, for listening to me today. And I really urge you to reform Aspire with the needs of college student parents in Maine in mind.
Thank you, Lisa. Next, we'll hear from Lisa Marcuscio. My apologies. I'm sorry, Representative Madigan, did you have a question?
Yes, for Ms. Black. First of all, I represent the Waterville area and I work in the community, and I want to thank you for the amazing work the TRIO program at KVCC does. I've worked with a number of clients that have used your program, and you guys rock. And I wonder if you could tell me a little bit about, so folks are aware of what the TRIO program does and how they can support particularly first-time college students, first-generation college students, people who are having some more challenges in being successful at higher education.
Thank you so much for those kind words, Representative Madigan. Really, what we do is, federal TRIO programs, they're a nationwide program, and they're designed to increase college access and graduation rates for students from underrepresented backgrounds, including students who are meet income eligibility guidelines, students who are the first in their family to attend college, and students with disabilities. And really, we there's a range of mandated services that we have to provide, and the way we choose to implement them varies from program to program. I can tell you that in Maine, the student support services TRIO programs all take an individualized approach to working with students. So we get to know them on an individual basis, and then we customize degree plans to meet their needs. So for example, we wouldn't recommend an 8 a.m. class to a student parent who needs to get their kids on the bus in the morning. And that is something that as a first-gen student, I was a first-gen student, and I knew nothing about how higher education worked. And I kind of fumbled my way through. And without navigation services for people who really understand the unique needs of TRIO students, which is most of the students at KVCC. And I can tell you as well, throughout the Maine community college system, most students are, at KVCC, 92% of TRIO students were eligible for TRIO in one or more categories the last time we looked at the data. And it makes all the difference, really. Like, really, it makes college work for individual students instead of students having to figure it out themselves and kind of adjust their lives to institutions that are not always set up to meet their needs. So really, that was a lot of things I just said, but the individualized approach is what makes TRIO work. And we really do. Federal TRIO programs have been around since the 1960s. KVCC's has been around since 1993. And we graduate students who you would never dream would graduate from college at much higher rates than students who don't qualify for TRIO, students who do have different advantages. So I'm here to tell you TRIO works, and it's the individualized approach that causes us to work. And I can provide you data if you'd like that too, about our success rates.
Yeah, if you could send that to the committee, that would be great. And thank you so much.
Thank you so much for the opportunity to speak.
Thank you, Ms. Black. Lisa Markaszewski. Lisa? Lisa Markaszewski? Not seeing Lisa. I'll move next then to Michelle Lamb. Ms. Lamb. Welcome.
Hi, can you hear me okay?
We can.
Okay, hi, good morning. Well, I don't know if Lisa will pop back on, but she used to work with me. So much of my testimony is actually from some of her work. Good morning, Senator Claxton, Representative, Mayor, and members of the Health and Human Services Committee. My name is Michelle Lamb, and I'm the Executive Director of Greater Portland Family Promise. Greater Portland Family Promise currently uses a three-pronged approach to homelessness, such as homelessness prevention, shelter, and housing stabilization. Families receive help with basic needs support, such as food, transportation, rental assistance, and ongoing housing mentorship. 93% of the families that we serve are asylum-seeking immigrants, most of them from Angola and the Democratic Republic of the Congo. Most families are not eligible for public benefit programs for their first year or until they've applied for asylum. Newly arrived Mainers are dealing with loss, trauma, isolation, and difficulty adjusting to this new culture, climate, and language. It can take more than a year for people to receive their work authorization, and at this time they have zero income and rely on general assistance, Maine Care, SNAP, TANF to meet their food, healthcare, and housing needs. Prior to working at Greater Portland Family Promise, I spent 9.5 years working at Preble Street as the program manager for the Maine Hunger Initiative. I know from that work and this work that there are many barriers for families to addressing their housing, healthcare, and food needs and employment. And for asylum-seeking families, it's even harder and has been exacerbated by the pandemic. This includes job loss, lack of access to culturally appropriate services, isolation, difficulty accessing food pantries, and others getting appointments at social service agencies. Furthermore, housing instability and the risk of eviction has increased and worsened during the pandemic. In addition, Portland, Maine is currently experiencing the tightest rental market in history, making it hard for us to find affordable apartments for the families that we work with. Many of the people we work with are not fluent in English, have very low literacy levels, no formal education, and limited access to technology. For those with limited English, there are very few training programs or apprenticeships that they can actually access through the Aspire program. And families often fail to meet the requirements or access FedCap's online programs because they don't have internet connection at home, or their hotspot is too weak. Missed phone calls and letters arriving after scheduled meetings often lead the family to be wrongfully dropped from the TANF program and causes them to lose access to this life-saving benefit that pays for their rent and food. I want to thank the Maine legislator and the Office of Family Independence for taking the important steps towards policy changes that will reduce
30
barriers
seconds,
to participation. And I want to strongly encourage you to take further action to simplify and improve access and delivery of these essential public benefit programs and ensure that our state has the strongest safety net possible to meet the needs of low-income families. We need more forward-thinking policy changes that increase access, reduce barriers, and provide pathways to long-term financial stability. I urge you to build on this work that you've been doing in your work groups and to enact some of the recommended changes, such as removing sanctions, asset tests, and increasing access to education and training. Thank you.
Thank you, Ms. Lamb, for being here today. So we're going to go to a number of testifiers in one place. So we have Alina Diaz, Flavia, and Michelle Gagne. So if you want to open up your video. And so we'll hear from everyone joined there at this computer, and then we'll move on to Sean Yardley, and Stephanie, I believe, was brought in as well. So that's the order we'll go in.
Good morning, Senator Claxton, Representative Mayer, and members of the committee. My name is Casey Henderson, and I have a 5-year-old son named Peyton. When Peyton was younger, we were on FedCap program and received $363 in TANF monthly. That's the same amount my mother received from me when I was younger. Thankfully, I was able to be part of the LIP bill to increase that monthly allotment, but now we have bigger problems. While I was on FedCap, I wanted to be able to use all the resources available to me to be able to get a career that would make me financially stable for Peyton and I. Instead, FedCap continued to give me barriers. They wanted me to just be employed at a low-end job to increase their employment numbers. So I did that while I attended KVCC full-time. And I became aware of the numerous resources available because they didn't tell me. Like Parents of Scholars, the employment specialist continued with excuses why I was not eligible or requested outrageous documents. That may be why only 20 out of the 2,000 spots are filled now. I finally became eligible for Parents for Scholars just months before I graduated with my associates in mental health and was immediately kicked off the program. FedCap needs to change and be for the people instead of against the people. So today I'm a case manager and continue to see my clients struggle with the same problems that I had with FedCap. Is it ever going to change? Can we please make these changes? And I also want to include that I was excited to see the opportunities for improvement at DHS and how during COVID there were the changes that should be made permanent, including PEBT benefits every summer, even if we're not in a pandemic. To stop sanctions for FedCap and DHS reviews over the phone. I really thank you for your time, and I'm going to pass this to Alina Diaz.
Thank you. Welcome. You're on mute, Alina.
Sorry, that was accidental. Good afternoon. My name is Alina. I am a single mom with 3 daughters. We live in Warren, Maine. And I actually am a recent graduate. I graduated from UMA with a bachelor's degree in justice studies, thanks to the Parents of Scholars program. Despite the help I received through the state of Maine for my education, I experienced so many barriers in the process. Similar to Casey, when I expressed my wishes originally to my TANF worker, I was discouraged from attending college and was encouraged to quickly become employed.
So I ended up, I began school on my own since they didn't want to help. So I didn't start Parents as Scholars until I was about a year into school. And then at that point, I struggled to get any kind of services, including childcare. I'd be waiting months for them to pay my my worker, any kind of service. It was like pulling teeth to get those. I eventually had to get legal aid services to fight FedCap, get the services I was eligible for. And I even multiple times had to contact DHHS's liaison worker that would help me get my workers moving to get the services that I needed. So it was really a struggle the whole time. And while I was attending school, there was multiple parents like me who were facing the same issues or who couldn't get through school. And I would say, you know, go get the services that I'm getting. It's hard, but do it. But it's so challenging. It takes a lot. I learned to advocate for myself, but there's many people who just drop the ball and say, forget it. I'm also a person in recovery, and education is a huge part of my recovery. I don't think if I went to school, I would have such a strong health today. It's helped me in so many ways. And I think education can change so much for so many people. There's so much potential around us. I know so many of people my own age, moms, dads, that could benefit from an education that they weren't afforded. And I think that can change a lot of things in Maine. But I think that we have to fix the program to
30 seconds.
To work with the whole person so that they can address the issues that are keeping them from thriving and doing better. So I think there's so much room for improvement. The program's great, but it needs to be implemented the way it was meant to. So thank you for your time, and I'll pass it to Flavia.
Thank you.
Oh, am I muted? No? Okay.
Nope, you're good. Welcome, Flavia.
Hello, good afternoon. My name is Flavia de Oliveira, and I'm reading on behalf of Andrea Cook. So, and this is her testimony. My name is Andrea Cook, and I live in Bexter. I am a mom and a student. I am a caregiver of 2 children, ages 8 and 6. One is then my biological son, and the other one is my nephew. I recently got a job at Hannaford to help make ends meet. My real dream was to become a librarian in a small town like mine. I have been receiving help as part of the state emergency pandemic service. Once the state emergency lifted, I wasn't eligible for 10 extensions, but I have lost time in the past couple of years because of the direction FedCap has brought me. I felt the direction, I felt that the way they direct me for my goals for the 2 semesters was actually I lost time towards my goal of becoming a librarian. I am very upset about this. I was discouraged from going to school for library science because they said I should major in something that had a better job outlook. So far, 2 semesters and thousands of dollars in loans, I took their advice, but it wasn't what I wanted to do with my life, and I knew that. I felt pressure into changing instead of helping to find my path. I feel like I don't have the time to waste. I have a lot going on with my 2 kids with that high medical needs. My son has diabetes and was in diabetes coma for a week after being misdiagnosed. Both have mental health needs. Both have mental health needs, given them what they have been going through in life. We are currently living at my grandparents' home and are currently facing bankrupt. There is a lot going on for us, and we need the support and service that help to get on our feet and reach our goals in reaching challenging times.
30 seconds.
Okay, so she said at the end, I feel like I had, if I had stayed in the course of a librarian, my grades would have been improved and I would be in the path of reaching my goals. So when she has one question, I often ask the question, what's the point of continue on? We need to change in the kind of support, supporting low-income families, receiving support towards their goal, working with FedCap instead of setting them back. So thank you very much for listening.
And thank you for being here today.
So Michelle.
Hi.
Hi, welcome.
I am Michelle Gagne. I reside in Winslow. I'm a mom, and actually a single mom to 3 boys. And I have used TNF. Actually, I'm currently on the education extension. And right now I'm on the cusp of it. So I'm not sure. I know I'm 3 classes away from my associate's degree. So I feel like I'm constantly having to fight to get ahead, and kind of that's a huge barrier. And I know for all of us, we all want to succeed and support our families. And, right now my job is $12.50 an hour. I'm a case manager. And, just how am I supposed to survive on that? And there's a lot of barriers to keep our families afloat, even in the mental health field. The challenges a lot are reaching out to the providers, our workers that work with us. We're sometimes on hold for hours on end, maybe 4 hours on hold just to reach somebody on DHS. And I actually have a screenshot to prove that if you guys want that. I was on hold just to reach somebody to see what is going on with my benefits. Are they going to be canceled? And then we all have rent to pay, our families to feed. And we just getting that scare of possibly being cut and not having that income coming in, or even that support to get us ahead. So I just really would like to see change on making this a more trauma-focused, trauma-informed program, just having everybody, kind of work together. And we should, every family is different, but we all have the same goals. We all have family to support. We all have bills. We all have, necessities. And, some of us are part of parent groups where we all support each other that way too. There's even barriers on childcare. There shouldn't be, we need to get out there and work, and you want us to for the requirements. So it should be fixed. So thank you very much for your time today.
And thank you for being here.
Thank you.
Senator Claxton, the order should be Sean, Stephanie, Robin, and I don't believe we've heard from Michelle Lamb.
Why don't we go to Sean then? Thank you.
Senator Claxton, Representative Meyer, members of the Committee on Health and Human Services. My name is Sean Yardley, and I'm the CEO of Community Concepts. I have far more to say than I have time, so I'm going to be jumping around a little bit. But Community Concepts is a proud member of the Invest in Tomorrow initiative, which started back in 2017 when a diverse group of stakeholders came together to align our efforts toward the goal of increasing economic opportunity and ending child poverty in Maine. And through that work statewide, we heard from over 400 folks that brought their experience, their knowledge, and passion for improving the community together. Many of the evidence-based strategies identified through this process informed the 2019 Invest in Tomorrow bill package, Lift and Step, which created the legislation behind the report that you are seeing today. As someone that has worked in this field for a long, long time, I have some perspectives that I'd like to just quickly share. There needs to be an improvement in the coordination of government programs like TANF, SNAP, and general assistance to help families get ahead. Safety net programs should be simple, accessible, and well coordinated so families living in poverty can access opportunities and sustain economic security, while at the same time reducing inefficiencies in state government. People who come to community concepts with a variety of needs are often driven by gaps in the supports resulting from systemic issues that make access difficult rather than due to lack of personal motivation. Having administered general assistance in the past in Bangor, for the city of Bangor for 9 years, I repeatedly saw firsthand the challenges that people experienced in accessing services that they were otherwise eligible to receive due to eligibility cliffs, administrative barriers, including office hours and work requirements that created catch-22s and made benefit eligibility processes virtually a full-time job. Not because the applicant desired to work the system, but because they were forced to devote so much time to make the system work as it was intended, to provide eligible residents the benefits that could assist them as a bridge for their family to get ahead. I recall in one of our poverty forums, a gentleman who had been homeless, had been living in his car with his 2 small children, speaking up and talked about the assistance that he had received that allowed him to get
30 seconds, John.
to get a job and to be off all of the programs. And he had a flat tire. And very quickly after that flat tire, he lost his job and he lost all those benefits. And everything fell apart, all for the price of a flat tire. People live on the edge, and we need to move them away from the edge. And oftentimes the programs that you folks fund and the state oversees are not helpful and actually contribute to people living a very, very marginal existence. I appreciate the opportunity to speak. I would ask that you read my testimony, and I'd be glad to answer now or anytime any questions you might have. Thank you.
Thank you, Sean. I don't see any questions, so let's go to Stephanie Eglinton.
Thank you, Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Stephanie Eglinton. I'm Executive Director of the Big Children's Alliance. And our mission is to promote sound public policy and best practices to improve the lives of Maine's children, youth, and families. We're also part of the Invest in Tomorrow initiative with the goal of reducing child poverty. So we were advocates of the LIFT legislation in 2019 to support the economic security and well-being of Maine families and to ensure that our public safety net programs are working as effectively as possible. And we appreciate that this annual LIFT report can help us all hold us accountable to improving and coordinating federal and state anti-poverty programs and making them more accessible to those who need them. Effective anti-poverty programs increase the chances that children grow up outside the harmful effects of poverty and have a greater chance to meet their full potential. Of the 33,000 children in Maine living at the poverty level in 2019, over 12,600 of them are living in deep poverty with family incomes below $12,875. TANF is intended to ensure that children do not go without basic essentials. And we applaud some recent policy improvements, such as the elimination of the full family sanction and the enhanced earned income disregards. But we also think more needs to be done. The LIFT report indicated that in that period of 2016 to 19, just 28% of families with incomes at or below the federal poverty level were receiving TANF. And the Aspire Employment and Training Program is not meeting the needs of families, nor the goals of Maine's 10-year economic development plan. Just briefly, we're also concerned about the relatively low CHIP participation rate in Maine. The 2019 figure is that 7.8% of Maine children in low-income households are without health insurance. More could be done to promote outreach and enrollment in Maine's Cub Care CHIP program. And finally, I'd like to make the connection between investments in family well-being and the prevention of child abuse and neglect. The US CDC has identified conditions that increase the risk of childhood abuse and neglect, and many have been exacerbated by this pandemic.
30 seconds.
These include issues that are relevant in these reports, such as the burden of caregiving and caregivers who are experiencing high levels of stress and poverty. And then just finally, again, we encourage DHHS to continue to create a family-centered approach. So there's no wrong door for access to childcare subsidies, WIC, TANF, food supports, or training. And also the integration of these data systems is key for serving families better. Thank you.
Thank you for your testimony. Before we go to Robin Stanicki, or one of the two Robin Stanickis, I'd invite anybody in the attendee list who hasn't had a chance to speak yet to indicate that they would like to by raising a hand or sending me a note in the chat function. So let's go to Robin Stanicki.
Hi there, and I do apologize for joining the meeting twice. I'm having some technical difficulties. So thank you and good morning, Senator Claxton, Representative Meyer, and members of the HHS committee. I'll talk today about some of my experiences with Aspire and TANF and how I actually created my own success. So I was a third-year student when I heard about LIFT. I was working on a paper at that time to identify ways to serve non-traditional students. And I was trying to sort of weave a social justice and trauma-informed lens to designing and improving welfare. So I proposed serving parents in a way that worked more easily with, the realities of being a low-income family and the complexity of managing kids in college. So that was me. I had spent years in foster care. I was chronically homeless in my late teens and early adulthood. So I spent 15 years trying to go to college and I just couldn't get out of my own way. I knew that I qualified for the Competitive Skills Scholarship Program at DOL, but it took me about 3 years on the wait list to actually enroll in that. I was eligible by walking a narrow path between qualifying for food stamps, but not qualifying for TANF and Aspire because the CSSP has tuition, supplies, transportation, medical, clothing, and emergency benefits, and it just was a better program at that time by far. So if you don't know, students on TANF cannot enroll in CSSP, and so they have to use Aspire, which has a lot of barriers and attitudes, paperwork, and meetings to add to an already hectic schedule. And as Alina pointed out, it takes hours to get through on the phone to get anything, and it makes you feel like a lesser person. In 2018, I testified here that very few programs adequately served my needs, and I felt like I had to cobble several programs together using these small print loopholes to make it work. So I felt like I was more in control of my future and, without any hoops to jump through and gates to unlock, I could call my own caseworker with any issues and he would answer the phone anytime. So I ended up leaving that program with 2 degrees and an acceptance to a master's program. My goal was to specifically address the needs of students like myself that struggled to meet long range goals while standing on the edge of the welfare cliff.
30
so
seconds.
The connection. I'm so sorry. So where am I now? During the pandemic, I was resilient. I just bought a house. I got a better job. I have 2 graduate degrees and I'm in the driver's seat. I work as a community planner working in public health, and I address the importance of the social determinants of health like housing, food insecurity, and economic justice. So the report we have heard today, I helped to create that a little bit, and we can leverage and divert more of our efforts toward these priorities so that we can lift others out of poverty, to get out of our own way and on our way. Thank you very much. I appreciate your time.
Thank you for apparently overcoming most of the challenges, the technical challenges. As I understand it now, we're going to hear from Louisa Desprez, and then Ann Danforth and Mariah Gear.
Thank you. Can you see me?
We can't, we can hear you.
Oh, okay,
Now we
there
can
I am.
see
Okay, thank you very much. Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. I appreciate this opportunity. My name is Louisa DePrez. I'm a professor emerita of sociology at the University of Southern Maine. I began work in the state in the 1970s in the then Department of Mental Health and Corrections and was responsible for closing down the Children's Psychiatric Hospital at Pineland. For over 50 years now, I have been active in work that seeks to combat poverty at the local, state, national, and international levels. The compilation of information that you have before you, I hesitate to call it a report, represents an extraordinarily grim and frankly embarrassing picture of the status of people in the state of Maine. It demonstrates how poorly the state is working to help people secure family stability and move successfully out of poverty. The systems of support that the department has under its purview are supposed to assist people in leaving poverty, but this compilation of information reveals the opposite, that the department is not fulfilling its obligation to its established purpose in this state. In her letter to the committee, Commissioner LaBrue writes that the department was not funded for this report, but in fact, the data in this report is their responsibility to collect regularly, to assess, and to use in ensuring that programs are in fact working, and that if they're not, other avenues that could lead to their success are developed. Let me just give you a case in point from this report. In the compilation, for example, we find that 26% of all children living in poverty do not get help from TANF. That number has not significantly changed over the last 4 years. I hope the committee will ask the department why. 84% of families leaving TANF were still in poverty, a figure that again has not changed over time. Again, the question is why? When Parents as Scholars began in 1997, 2,000 slots were allocated for single mothers seeking access to secondary education. At no time did the state serve more than 1,000 single parents. Most likely, well, actually, because it was at the regional level that the problems were happening. Caseworkers were not engaging students in accessing higher education. Now, as of July 2021, it is my understanding that 20 parents are enrolled.
30 seconds, please.
Post-secondary education has been proven time and time again to be a means of moving families out of poverty, as well as being the impetus for children in those families to achieve success. I have done this work since the program began in 1997. With a colleague, we tracked over 900 families over a 10-year period, and I can guarantee you that this kind of a program works. This picture of Maine residents is dire, and I would like to say that it raises red flags, especially over the consistent, unchanging over time numbers that it represents about the state of insecurity in Maine residents. I am hoping that the committee will take this opportunity to see the plight of Maine families and really take steps to rectify it. Thank you.
Thank you, Professor DePrez, for that testimony and that perspective. Next, we'll go to Mariah Gear.
Thank you so much. Good afternoon, Senator Claxton, Representative Meyer, members of the Committee on Health and Human Services. My name is Mariah Gear, and I am the Moxie Case Coach at Maine Equal Justice. In my position at Maine Equal Justice, I work directly with people who contact us looking for help navigating these programs. A great deal of my time is spent listening to the struggle of people who've had to work with FedCap and strategizing with them to come up with a plan to make things better. We've worked with nearly 150 FedCap clients in recent years. I'd like to share some of the stories with you today to illustrate some of the issues that we often see as people are required to work with FedCap. You saw a lot of numbers today, but what I'm going to share with you is the experiences that people share with me on a daily basis. I'm going to try to be fast and succinct, but you can read more in my testimony that's been submitted. First, I want to say that most of my clients who do find employment do so in spite of FedCap and not because of them. If anything, the requirements that FedCap enforces drag things out and make work search take longer than necessary. Next, I'd like to talk about educational attainment. Education was my pathway out of poverty, so I tend to talk to most of my clients about that option. I'm appalled at how many people don't realize that they can get help to go to school. Those who do know and try to go to school are often faced with unnecessary barriers by FedCap. They tell me that they're discouraged from college, that they're told that the PASS program is complicated or that it has a wait list, or sometimes they're even told that college isn't allowed on TANF. One day, for example, I was contacted by a nursing student with a toddler who was taking 18 credit hours, but was considering dropping out. It wasn't because she was struggling to be a parent and go to school at the same time. It was because she was told by FedCap that she would have to work an additional 30 hours on top of her classes in order to meet her requirement, that they were not counting her school at all. And supposedly, they were also telling her that she was already in the Parents as Scholars program. Many times when it comes to education, they don't seem to understand how this program is supposed to work. And that definitely places more additional barriers in front of people. That's not an unusual story either. Another client of mine on the other end of the spectrum only has an 8th grade education and wants to get a GED so she can show her child that it's important to get education. Until we got involved in her case, FedCap was not supporting that. They would only tell her that she had to go find a place to volunteer to get work experience. They only wanted her to go and join the workforce. But this parent is unlikely to find work that will lift her out of poverty without a GED. Also, not everyone on TANF is ready for work or for education. Domestic violence, mental health disorders, substance use disorders, and other disabilities are all things that may be faced by the individuals getting help from the TANF program. They're pretty common. Trauma is very common when we talk to people living in poverty. But FedCap is also not doing a good job at helping these folks either. I have a client with 4 children who went on TANF nearly 5 years ago after leaving a very abusive marriage. The last 4 years had been one battle with FedCap after another. She and her children need intensive mental health management and treatment to move past their trauma, but that's not being supported by FedCap. Essentially, what she tells me when I talk to her is, I've lost my 5 years, they're almost over, and I haven't made any progress, and I can't get that time back. It will never come back to her. It doesn't matter what improvements we make in the future of this program, she's not getting that time back, and she will lose that eligibility soon and have no way to move forward. So not only has FedCap not helped people move forward, but often my take on it and the thing that people share with me is it makes their lives worse. I have a person that I've worked with who is in recovery from substance use disorder. And when she first got on the TANF program with an infant, they told her that she had good cause because of her substance use and treatment. And she was able to stay home with her child. And then one day, all of a sudden, her caseworker was changed, and they told her that she had 1 week to get in and get her child into childcare and start looking for work immediately. During that time, while she tried to manage their expectations, she tells me that she relapsed into substance use, and she tells me that she believes that it was because of the requirements from FedCap. I've also heard from many people that they've had to increase their medication for their anxiety disorders or seek mental health treatment because of their interactions with FedCap. This is not what we want for our citizens. It's not what we want for our neighbors. It's not what we want for Maine parents. As our state moves forward with improving our workforce and attracting new people, it would be a tragedy if we left behind the potential workforce that low-income parents who are already here represent. As a state, we're already spending a lot of money and a lot of time and a lot of people power on these programs, but the numbers tell us that these programs are not currently making a difference or meeting the need. We need to do better for these parents, for these children, and for our entire communities. Thank you for your time. I'm happy to answer any questions.
Thank you for the testimony. We'll go now to what I understand to be the last person testifying in this section, and that would be Ann Danforth. Welcome.
Thank you, and good morning, Senator Claxton. Good afternoon, I guess, Representative Meyer and members of the Committee on Health and Human Services. My name is Ann Danforth, and I'm a policy advocate at Maine Equal Justice. We're a nonprofit civil legal aid organization working to increase economic security, opportunity, and equity for people in Maine, and we worked closely on the 2019 Lift and Step bill package, and we're grateful for the opportunity to testify today. Because of the powerful testimony you've already heard today, I will refer the committee to my written testimony and just do my best to summarize the most concerning takeaways from the report and highlight a few key recommendations based on our participation in the LIFT working group. And while we can always use more data, the data we have is enough to recommend significant changes to DHHS programs. TANF is serving only 1 in 4 of all children living in poverty in Maine. More than 4 out of 5 people leaving TANF were still living below the poverty line. More than 3 out of 4 people who moved off TANF did not obtain education or training opportunities beyond high school. And in July 2021, only 20 parents were enrolled in Parents as Scholars. And because there was discussion about this earlier, I just want to lift up that according to DHHS's report, the educational characteristics of people on TANF are nearly identical to those who have left the program, indicating that educational services provided by the Aspire program are extremely limited. And many families who are struggling are not getting the support they need despite being eligible for it. While these data illustrate the need for real reform at DHHS, fortunately, the 2020 LIFT Working Group provides thoughtful solutions DHHS could adopt to support low-income families in joining and succeeding in the workforce. I want to highlight the following 3 priorities based on the data in the LIFT report and our experience in the LIFT Working Group. 1, Aspire could and should be part of Maine's workforce solution, but it is not living up to its promise as it's currently being administered by FedCap, as you've heard in such powerful stories today. Based on FedCap performance to date, we don't have confidence that they're able to run this program effectively. To truly improve employment opportunities, TANF work programs should focus on centering the individualized needs of participants and placing people in jobs with opportunities for advancement or in education and training programs that will prepare them for higher paying jobs. And we want to recognize and appreciate the department's acknowledgement of certain shortcomings of the administration of the Aspire program and that they're taking steps to do things differently and move in this direction. 2, we've heard today about the many hurdles people have to jump through to get the help they need, or that people don't know about supports available. We need to simplify and better coordinate the delivery of safety net supports and services. And 3, people seeking services from DHHS should receive compassionate, trauma-informed, and culturally competent treatment. We've heard too many stories today illustrating that that's not happening and that there needs to be a structure for people to raise concerns and provide feedback to DHHS, which will increase accountability and make programs more effective. To wrap up, I'll just emphasize that we have the opportunity now to make real lasting changes that will address the issues you've heard about today, increase economic security and opportunity, and strengthen our workforce. Thank you for the opportunity to testify.
Thank you and appreciate your contribution. So at this point, I think we can conclude the work on the LIFT report. I want to make sure to thank Director Pilot for hanging in there with us and sharing that data and lining up some future improvements, enhancements. So thank you very much for that and your time today. And I want to thank Deputy Director Ham for her contribution to the conversation. And then we're going to turn it over to you, Chair Ham, to talk about the working group, if you have time in your schedule right now.
Certainly, I think we can run through these rather quickly. I know you have a lot on your plates today, so I do want to give it due diligence, but also want to recognize that you're up against some time constraints here as well. So the next few slides that we're going to go through, you heard actually quite a bit about this during the previous testimony. So please interrupt me if you have questions, but I'm going to walk you through the working group that convened as a part of LD 1774. So that LD required the department to form a group to look at DHHS processes and programs and to identify ways on how we can improve upon them. So the systems improvement work group had some statutory objectives laid out for us as part of the LD, and those are in front of you in this slide. I won't read them off, but that was our kind of governing direction. So Molly, you can move on to the next slide. It also outlined various requirements of who should be participating in the work group. So they required participation from certain community organizations and agencies. It also required the department to make sure that we had some current or past participants that were on the program, TANF program. So this is the big group that convened. And I must say they did an awesome job. We all, I think, collaborated very well on this. The commissioner did direct me as the deputy commissioner to chair this group. And so what I did was convened the group. I believe it was in November, could have been earlier than that. It's been a while, so forgive me. And we met here at the Department of Health and Human Services. And we all, as part of our discussions, kind of looked at our charge and developed a pathway forward at which we would tackle the various obligations that were before us. So as a group, we came to a consensus that we would break out into 3 distinct groups, which included people and process, technology, and policy, again, based on those statutory objectives. We had folks volunteer for each of these groups. Many volunteered for the groups that they felt they would provide the most expertise and strength to. So that worked out very well. The people and process key recommendations that came out of that group were those that you see on this PowerPoint slide at the moment: improving engagement with and understanding of communities served, better understand individuals accessing programs, expand staff training, increase the number of individuals served, and increase efficiency of processes. The people and process work by the department. I think I'm going to hand this over to Tony. Tony kind of led some of this. So do you want to chime in here, Tony?
Yeah, I'll just mention this is the training I was one aspect of the training I was mentioning earlier. It's called Culture of Respect and Empathy. It's really, right now, it's a 2-part professional ethics and diversity training that we saw a need for, and essentially it sets the tone for all staff so that they can be better prepared for all of the different social aspects that our staff deal with when assisting people with our programs. It's a very extensive curriculum. It's generally a whole day's worth of training plus materials that goes with the first part. And the team is currently working on a second iteration of this program, which builds on this first 101, if you will. So very positive returns on this effort. And we've also made it available to other offices in the department, which it's been utilized broadly across all of the different offices in our department, and also received quite well from those folks. So very proud of this core training program. I think another important item I'd mention here, Beth, and I know you probably want to roll back to some of the other items, is just the work that we've been doing on the community-based organizations. I think you had mentioned earlier the child tax credit. This has been one example of this outreach success, which has been provide this platform for advocates like Maine Equal Justice to take advantage of our support network and get the word out about that great program.
Yeah, and this slide really doesn't do justice to the work that we have been collaborating with as a department and with the ethnically community-based organizations and other agencies like the CAP agencies throughout. What prompted it, obviously, was a recommendation from this report, but what really ramped it up very quickly was the pandemic. And so we gathered a stakeholder group. We listened and had some very, very, I would say, direct listening sessions and
We took those recommendations from these community-based organizations, our partners, as well as advocates, and built the programming that best served their community's needs, especially during the pandemic. So I just want to say thank you to everybody that's been involved in that work. And we continue to meet on a regular basis, and I would say have some really great working relationships as a result. So that recommendation from this report, I think, is bearing fruit. Next, Molly. So some of the key technology recommendations that came out of that work group were to simplify online applications and improve application features, streamline application processes to promote enrollment in underutilized public programs. And with that, some of their recommendations as to how we could achieve that. So I think Tony's going to walk through what we have done in response to some of those recommendations.
So two areas that have tied in to the LIFT discussion. Obviously, some things that were already in flight, but really cemented the need was changes to the office's noticing. We recently, within the last 2 years, and since this committee had met, launched new noticing that makes it easier for folks to understand the programs and what the outcomes of their applications were. So I thought I'd add that in there. I didn't see it well represented here, but that was definitely something that came out of our discussions and as an area of need, which again, we were already working on, but was able to finally get across the goal line shortly after these discussions. And then the real big item that we're tracking right now, working diligently on, is a new online service. The current service, My Main Connection, was implemented in 2000. And so as you can imagine, with today's technology, just a few years goes by and to, you know, the great technology of the day has passed us by. So this new technology that we're putting in place is informed by a lot of the feedback that was provided by the LIFT group. So more ability for this product to be used on mobile phones. It's not specific to having a computer, if you will, in order to apply for services or to recertify for services. It has better question and answer interactivity. So instead of stagnant pages, for example, that you have to go through and answer questions which may or may not be applicable to the specific needs of your household, this new product will be a little more dynamic on that front and consider the information that you're entering as you go through the application to make it a more streamlined process. There'll be a lot of auto-population of data. So if you've applied with us before or been on one of our programs before and are looking to renew the relationship, if we know about the data, it will pre-populate the many aspects of this application process. We'll have better communication, so text messaging and expanding our ability to provide electronic noticing will be part of this effort. And it'll just have a different look and feel than the product that we had. And I don't think that can be understated, how important a neat, streamlined approach to benefits can improve on. What we've heard from some of the comments today is there's a lot of complexities and confusion, and we want to reduce that by taking a more modular and clean approach with how we present opportunities for people to apply for these benefits.
Okay, let's move on to the key policy recommendations that came out of the policy work group. So you can see those here. We broke it out by the programs within food supplement, temporary assistance for needy families, some program administration type of activities that could help with policy, and also main care. I won't read all of these. You have them in front of you, but I think that what came out of those policy discussions were very good discussions, and I can speak to on the next slide what the department has done so far with regard to the policy recommendations. And so, Tony, please chime in here if I miss anything, but in food supplement, there were elimination of asset limits, remove the asset limits for older and disabled populations first, and then increased access to post-secondary with post-secondary students by offering some material and help and education as to their eligibility for SNAP. Again, in temporary assistance for needy families, we eliminated with your help, obviously, the full family sanction rules. Tony talked about this earlier in the presentation, so I'm not going to go through all of these because some of these are repetitive, but he did talk about things that we are going to do with regard to rulemaking around how we provide 60-month TANF extensions and things of that nature. So those rules are in progress, and once they're promulgated, folks will have an opportunity to comment on them. Main care, they're in the finalization of promulgating rules to provide expanded presumptive eligibility. Again, Tony talked about that earlier. Also, a state recovery rule of law changes were made, and now the state of Maine applies the mandatory estate recovery requirements, but doesn't overreach. Also, there is coverage that will be implemented to children and pregnant women, regardless of the citizenship status, that passed in the biennial budget. So that, again, was part of the policy recommendations. You want to speak to the program administration piece of it, Tony?
Yeah, I was really gonna highlight, we already talked quite a bit about the training aspect for staff and folks in eligibility branch here at OFI, but I thought I'd mention also there's been a good deal of scrutiny applied to SAVE, which is a verification for non-citizens to get information for applications and recertification eligibility. And so just wanted to highlight that there's been a lot of work at reviewing both federal and state regulations and the policy that connects those things. And we've done a good deal of work in response to concerns about the SAVE program.
Okay, next slide. That's it. So
it is. We certainly abridged this piece intentionally because I know we were short on time, and we covered a lot of the policy work in the beginning, but I will end the sharing if we want to work on questions. And we also have a couple of slides looking to be responsive to some specific questions around FedCap that we received from the committee. So I will take your lead.
Sure. Let's see if there's any questions from the committee. I don't see any hands up. And there not being any, I think we missed somebody on the last testifying round. So I'm looking to see if Mr. West is joining us there. Simon West, welcome, sir. If you wanted to offer some testimony based on the LIFT report.
Good afternoon, Senator Claxton, Representative Meyer, and the distinguished members of the Health and Human Services. Committee, I am Simon West from Gardner, Maine with the Maine State Chamber of Commerce, and I am here to present Dana Connor's testimony. He wanted to be here today, but he is on site filming with Senator King on a project for the Maine State Chamber. So I would just like to read his testimony as he has written it. Senator Claxton, Representative Meyer, and the distinguished members of the Health and Human Services Committee. My name is Dana F. Connors, and I am President and CEO of the Maine State Chamber of Commerce, which represents thousands of employers of all sizes and sectors across Maine. Thank you for the opportunity to share testimony on the Maine's Department of Health and Human Services recent report, Measures of Child and Family Economic Security for Families Participating in Maine's Public Assistance Programs. As background, in 2019, during the 129th legislature, the Maine State Chamber testified in support of LD 1774, an act to reduce child poverty by leveraging investments so families can thrive. We were pleased LD 1774 was enacted, and today wish to reiterate our support of the law in the annual report DHHS now provides on the economic security and well-being of Maine children and families. Understanding how well government programs do to reduce poverty and create economic opportunities for Maine people is key to helping Maine people and Maine's economy thrive. From a business standpoint, reducing poverty by connecting Maine people and families to education and employment opportunities and making sure their basic needs are met will help strengthen Maine's workforce and economy. The size and skill level of Maine's workforce have long been one of the biggest challenges Maine faces. The challenge has been exacerbated by the COVID-19 pandemic. Multiple efforts are required to solve this challenge. Knowing what is working well and where gaps lie in public programs addressing poverty, including those that aim to help educate and employ people, will help us better understand where more effort is needed, address those areas, and grow Maine's workforce and economy. Understanding and resolving these gaps will also help meet several workforce goals identified both pre and post-pandemic, including the 2020 Mills administration's 10-year economic development strategy and the governor's COVID-19 Economic Recovery Committee report, as well as the Maine Spark initiative launched in 2017. The Maine State Chamber is proud to be a leading member of the Maine Spark, a coalition of schools and universities, nonprofits and foundations, government agencies and businesses working together to achieve a common goal that by 2025, 60% of Mainers will hold education and workforce credentials that position Maine for success. The Maine State Chamber has testified before that there is no singular solution to Maine's workforce challenges. The DHHS report before the committee today is key to guiding and implementing strategies that improve programs aimed at removing barriers to education and employment. Paving pathways for all Mainers to achieve success will result in a stronger Maine family, communities, employers, and continued economic growth. These pathways also can serve to advance opportunity and economic equity in Maine. Furthermore, the impact on economically disadvantaged families can be generational. Parents who succeed also improve their children's chances of having a bright future. As Maine's economy continues recovering from the COVID-19 pandemic, strengthening opportunities that connect Maine people to education and jobs is critical. The Measures of Child and Family Economic Security for Families Participating in Maine's Public Assistance Program report is an important tool to help guide and direct necessary adjustments that can be made so these programs work optimally. When these programs work to their fullest potential, more Maine people, our business community, and Maine's economy will have the chance to do the same. Thank you for the opportunity to provide testimony today, and to DHHS for their work providing this important report. Sincerely, Dana F. Connors. Thank you. He wanted me to state that this is an important issue to him, so if anyone has questions or would like expansion on the testimony, please do not hesitate to reach out to him.
Thank you for that and that offer. So we can go back to Molly. You had some additional input on Fed Capital. And then after that, we'll take a break until 2 o'clock when we've lined up having folks come back for the afternoon session.
Great, thank you. Yes, and I'll share slides in just a moment. We have a handful of slides that are directly responsive to some questions that we received from the committee. And so we'll talk a little bit about just providing some context for the history of the Aspire program contract, as well as an overview of the oversight structure of that contract, and then focus on the RFP for the contract as the sort of already established end of that contract is September 2022. So I will ask Tony to get us started right when I share the screen here.
Great, thank you, Molly. And first of all, I'd just like to take a brief moment to say thank you very much to the committee and the public for all their comments and feedback so far today. I've got almost 25 years of state service in with the department, almost all of it with Family Independence, and I've held many positions in this office. So it's very important to me to hear the feedback because, you know, I share everyone's goal in wanting to provide the best possible service to Maine people. And please also, we've got a lot to talk about, obviously, with FedCap and Aspire. That's clear from many of the comments. And so as we run through the slides that we have here, please don't misunderstand the brevity of the presentation as the lack of wanting to address or discuss these issues. I'm happy to always make myself available for further discussion about this particular topic. So just for a little context on the Aspire program, we did award the contract through procurement. There was, you know, it's a state rule to go through and put out what you're looking for in services and then assess the different bidders that provide. The contract was awarded to FedCap in 2016, and it was awarded for a 6-year period, which was the maximum allowable period for allowable from procurement rules in the state at the time. Of course, by 2019, the program had been operating in 3-4 years, and we've gotten, you know, had gotten some feedback about the program not operating effectively. After some discussion, it was decided to take advantage of an independent third-party vendor to come in, get familiar with the contract and the Aspire program, both at a federal and state level, and then assess the performance of the vendor. Based on this independent vendor's assessment, there were some gaps in the services being provided by FedCap, although it was not a blanket finding across all of the locations across the state. FedCap operates 16 regional office locations. So what the report showed is that some offices were doing an exceptionally good job at this particular service, whereas others were not doing a great job. Based on the reporting from the vendor and their recommendations, a plan of action and milestones document was put together that listed out all of the individual tasks that needed to be undertaken to inform and push improvement for the vendor. And from that document and the resulting work that was done, contract amendments were made to incentivize and maintain those improvements. So that's the context. Let's go to the next slide, Molly. Thank you. So a lot of questions about, you know, the level of involvement from the department and some of the comments and questions that we heard today, I think can be addressed, or at least we start the dialogue of what the level of involvement from the department is. One thing that came out of the individual assessment was we heard a lack of understanding of, you know, policies and options for clients participating in the Aspire program as administered by FedCap. So one of the things that we did here at the office was we allocated a number of resources regionally at direct line oversight from our office and our senior program manager and program manager for TANF and Aspire programs, were resources across the state that would be embedded with the FedCap regional offices to ensure that there was understanding about policy, processes, and opportunity. So it lists here just a little more detail. I won't read the slide to anybody, but you can see we had 10 of them, and it gets into a little bit more detail about the specifics of their roles. We also had implemented some additional quality measures to ensure that complaints and concerns about the program were being reviewed and addressed by our program managers here at OFI's central office. I think that's good for this slide. I'm sure we can come back if there's questions, obviously. So we can go to, oh, you got the next slide. Sorry, I got my big slide up over here on that. I didn't move the slide forward. Okay, there we go. I'm with you now, Molly. Okay, so tracking, investigating complaints and concerns. This again just gets into a little bit more information. Obviously, we have many ways to receive complaints and concerns by clients. We either get them from FedCap, we can get them from these regional policy individuals that are out embedded in the different regional locations across the state. We get them from eligibility specialists who are assisting the clients with their applications or recertifications. We have constituent service resources, both at the office level and the department level. And occasionally we get some constituent concerns from the governor's office that make their way to our office. All of these are handled and reviewed by constituent resources and or the program managers for our TANF and Aspire programs, depending on the nature of the complaint or the concern. All set here, Molly. This here is just listing, some of the improvements that have been made to the Aspire program over the last, year plus. Obviously, we're trying to improve on enrollment in secondary education and training. We've heard a lot about how important this is to people, and we agree. We also acknowledge that education is a key component to folks finding and sustaining employment for the good of their family and their future. So those are some things that we've also been trying to find unique ways to make sure that people are informed about these as options and how to avail themselves of them if that's what they choose for a path. We've made many staffing enhancements. So we've looked at making sure that we have adequate resources from the state side to ensure we're putting the right attention and detail into all of the concerns that have been coming forward to us from on the Aspire program. And we also have these new supports in place for new Mainers with all of the recent talk about concerns overseas, and obviously Maine has always been welcoming to new Mainers who are looking to start a new life here in Maine. These are some supports that we felt were important and have started to implement through OFI and the department as a whole. Molly, I think we can move on to the next slide.
Hi, Tony. I'm going to jump
in.
Yeah,
please go ahead. Yep.
I think bring us to closure. But so what are we looking at moving forward? And that is, Tony did mention that there is a RFP in development based on when the contract is scheduled to expire by procurement rules. We do have to go back out. But the approach that we took in developing this RFP was an approach that was informed by national expertise like folks from the Center for Budget and Policy Priorities in terms of, what are the best practice models within TANF programs across the state that we can look to incorporate into our re-envisioning of how we deliver the services in both TANF and Aspire. That led us to talking with an individual that was recommended who has an area of expertise in this, in the development, because when you're writing an RFP, your bids that come in are only going to be as good as how you write it. And so we really sought to leverage some expertise that would help us get to a model that a lot of the folks that you heard from today are looking to have. I can't go into a great deal about the RFP because it's not posted yet, but what I can speak in generalities that we're looking to have a program that operates and functions with a family coaching model. Those type of models are very well received, especially in 2-gen programs. Also a restorative practice model. And to give you an example of where we would use the restorative practice model is in particular with sanctions and good causes. So that I think will go a long way in having not a punitive approach, but rather a social science approach to moving families forward. Trauma-informed approaches, again, I think you heard some of that in the testimony today. Culturally and linguistically appropriate service delivery as well. And then we're also looking at the potential for a hybrid service delivery model of our Aspire program, which again, in general, would have some DHHS delivered services and some vendor delivered services. So essentially, perhaps taking some what makes sense pieces back within the department as we move forward. And then a heightened focus on 2 major pathways, and that's education or job placement based on where the participant is at. And that doesn't mean that we're not looking at barriers that may come into play, maybe a disability. Obviously, if that's the case, then we'll go another route. But we really want our participants to understand, here are your benefits from education. If that's the path you want to choose to go down, then we structure and build their support system around that pathway. If you want to be into the workplace sooner than that, what do you need in order to upskill so that you can go into a job that isn't paying just minimum wage? And I will end there.
Thank you. Thank you for that, for both of you. I see a question from Representative Madigan. When you're unmuted, we want to hear from you.
Thank you, Mr. Chair. Thank you, Ms. Ham. I have a question about, well, a couple. One is when you're talking about you're developing the RFP now, and it looks like from what you've said now, you're looking for that RFP to look very different than the one that went out in 2015. And so I'm wondering, and you've also mentioned you're considering some of the services coming back under DHHS, which is some of the concerns I think over time we've had about FedCap, is some of the decisions they were making weren't in the best interests of clients. So I'm wondering when you expect that RFP to be ready, and are you thinking that this would be one contract, or are there parts of what the Aspire program does that you envision that different providers could provide? Because you're really talking about redesigning this from, different than what it is now.
You're absolutely correct. We are. looking to do that, which is why we hired a national expert to help us in writing this. This individual had experience in both DC's program, TANF program, and New York's, which again were two areas that were described to us as models, exemplary models. So again, I'm a little hampered by the fact that we can't talk in great detail because of our procurement rules, but I can tell you that we did hold listening sessions with stakeholders, two or three listening sessions, but we held one specifically for community-based organizations, ethnically community-based organizations, so we could hear from them directly as to what they felt this program needed to look like in order to serve them both culturally and culturally appropriately. And so our model, I'll give you just a real quick, I will just say, it's gonna look like a 2-gen TANF program our vision is to have those wraparound services that are needed, have those distinct pathways that are going to lift people out of poverty, and but also apply those restorative practices so we're not seeing people sanctioned unnecessarily if we can help them get past those barriers in a more social, scientific way, so that we're not it's not a punitive model, but it's an accountability model in the same hand. I mean, we have obligations to our participants to help move them off public welfare programs and into sustainable economic situations. So I don't want folks to think that we're not taking that approach seriously either. It's just in a more scientific way that produces better results than just say quick sanction.
Thank you. And I just want to note that I appreciate that. And, you know, the previous contract was for 6 years, which is of course less than the 60-month time limit that families are expected to be successful under. And I think we've given the current contractor a lot of time to correct some problems. And in that time, there's families that have reached their limit and not been as successful as they could have been. And so my concern would be like, I'd like to see us have a program that does what you say, you know, that takes all those things into account, because people who participate in the TANF program have a time limit on how to reach those goals. And when they don't, it's mainly children that suffer.
Yes, we hear you. We definitely hear you. And I can tell you that, like Tony, I've worked in this department for several more years than he has. And I think the most impactful time that I spent in this department was to do desk reviews when we implemented the 60-month time limit. So I would say that I saw some very, very troubling things as a result of that. And I saw families that were moved off the program with no skills. So we want a balance here. And I guess that's what I'm saying. There are some things that the department can do well, and there are some things that others can do better, maybe through a contract. So I think we have to just strike that balance in order to produce meaningful results.
Thank you.
Representative Meyer.
Thank you, Mr. Chair. Seeing no other questions or comments from the committee, I just wanted to wrap up by thanking each and every member of the public for being here today to share their expertise and their experiences with us. We are deeply grateful. I want to thank Director Pilot for being here today and helping us through a rather disappointing report. And I want to both welcome and thank Deputy Commissioner Ham for being here today. It is a pleasure to have you here, and I know that I speak on behalf of many of my committee members that we are encouraged and pleased to hear that there is such careful thought been given to a program redesign and the work that we all are committed to improving the lives of all Mainers. So thank you. Come back and see us again.
And I'd like to echo that, obviously, for the time and commitment, both for the folks who were in the room and participating, and for those who submitted printed or electronic testimony. I think I'm looking forward to whatever the department wants to bring forward as far as proposed legislation to help keep moving forward with some of the things where there's progress. I think the RFP will be huge, and I'm not clear when that be available for scrutiny. But overall, it seems to me that the major challenge is to turn the LIFT report into a tool that continuously helps us improve what we're doing, and also trying to figure out some way to capture the very impressive work that came out of the working group and not lose that process as we continue to sort out how we're doing. So those are my parting thoughts. Again, thank you to Deputy Commissioner Ham and to Director Pilot. Very much appreciated. I think at this point we'll take a whole 12-minute break, and we'll come back at 2 to start a conversation where we'll hear first from Lucia Nixon of OPEGA, and then Director Landry and Commissioner Lambrew. So thank you all. So welcome back, everyone. For those of you who just joining, this is the afternoon session of a special meeting of the Health and Human Services Committee during the interim portion of our calendar. We're to catch up this afternoon with where things stand with several reviews that are ongoing around child protective services. And to that end, we're going to hear first from Lucia Nixon, if she has joined us. Not yet. There she is. Great. Okay, welcome. And then from Director Landry and Commissioner Lambrew. So welcome all. I'm not sure who else is lurking or attending, but let's introduce ourselves around the proverbial horseshoe, and we'll start with Representative Zager.
Thank you, Mr. Chair. Good morning, everyone. Good afternoon, everyone. Sam Zager, District 41 in Portland.
Representative Lemlin.
Good afternoon, everyone. I'm Michael Lemlin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good afternoon. My name is Holly Stover. I represent House District 89, including the beautiful coastal towns of Booth Bay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Senator Baldacci.
Good afternoon. My name is Joe Baldacci. I represent District 9, which is the city of Bangor and the town of Herman. Thank you.
Representative Perry.
Good afternoon. I'm Representative Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Calais, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point.
Representative Craven.
Thank you, Mr. Chair. Good afternoon. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Madigan.
Good afternoon. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Griffin.
Good afternoon. My name is Abigail Griffin. I represent House District 102, which is Glumber, Brant, and Keduskek.
Senator Moore.
Good afternoon. This is Mary Ann Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Thank you, Mr. Chair. Good afternoon, and thanks to all for joining us. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is Elliott, where I live, and parts of South Berwick and Kittery.
We're also joined by some staff that we depend on, starting with Anna Broom.
Hi, I'm Anna Broom. I'm one of the legislative analysts with the Office of Policy and Legal Analysis.
And Erin Dooling.
My name is Erin Dooling. I'm the other nonpartisan analyst with OPLA.
And Cheryl McGowan's been roped into being our clerk for the day, so thank you for doing that.
You're welcome.
And without the echo this time, so that's good too. And I'm Ned Claxton. I represent Senate District 20, which is Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. So according to the agenda, it looks to me that you're up. Lucia Dixon.
Thank you very much. Nice to see everyone this afternoon. Thank you for having me. As Senator Claxton said, I'm Lucia Nixon, the Director of the Nonpartisan Office of Program Evaluation and Government Accountability of the Legislature. I don't know how many, some of you are probably more or less familiar with OPEGA, but we are one of the nonpartisan offices, such as the offices that provide you with your analyst staff for this committee. And we staff the Government Oversight Committee, which is a 12-member bipartisan bicameral committee with 6 House members, 6 Senate members. And we are charged with conducting objective nonpartisan evaluations and reviews of state programs and agencies as directed by the Government Oversight Committee. So we strictly do objective evaluations that are very systematic and look at systems issues. And I'm here invited today because we have currently been recently assigned at the last summer DOC meetings to conduct an evaluation of child protective services issues. And we were presented with 2 requests in July from Senator Diamond and Senator Curry requesting an OPEGA GOC to direct OPEGA to conduct a review. And the committee did decide to initiate that review and directed OPEGA to come back for their August meeting with a draft proposed scope of work outlining the major issues and approach that we would take at a very high level. And so that was reviewed and discussed with the GOC. They did make a few minor edits and changes in terms of timeline, which I will go over with you, but overall they approved the prepared scope that we had laid out for them. And we are currently actively working on doing and sort of a very efficient and expedited stage of research that we usually do before we embark on an evaluation. It's called preliminary research. And it's a really important phase of the project because they wanted to get this going immediately. We are sort of doing that concurrently with doing the planning to actually get the evaluation underway. So I will also note, just for reference, that in the course of OPEGA evaluation, we are not able to, pursuant to our statutes, all of our work is confidential. We do not share any results or working papers or preliminary findings. We have a very strict protocols around that, and it's part of the nature of our work to do purely independent, objective evaluations. But there's also protocols requiring that we provide the evaluated agency with a opportunity to review a draft of any evaluation report findings systematically with a certain review period for them and comment period for them before we even release the report to the GOC members. So nothing will be coming out of our office until we have our first report, which the GOC has requested that we deliver an initial report in January of 2022. And that report will look at one of the 3 areas that have been included in this project. So those 3 areas that the GOC directed OPEGA to focus on, 2 are related to questions around protecting child safety. And so the first of those is looking at issues of child safety during the phase of initial investigation and assessment and the placement decisions made. And secondly, looking at issues around protecting child safety during reunification assessment and permanency decisions. So both at those 2 key decision points and assessment periods is where we will be focusing our work. The third piece of work, which is a little bit separate, is looking at more broadly, looking at oversight of child protective services, and particularly looking at the oversight panels. There, as you probably know, there are 3 panels set up in Maine pursuant to the Federal Child Abuse Prevention and Treatment Act, CAPTA. And there isn't one other panel that we've been made aware of through the Attorney General's office that provides some oversight functions. So we're going to do a piece of work, or they've directed us to do a piece of work to understand the structure of oversight and roles and responsibilities of those entities and identify barriers and gaps in the oversight that is provided, and also look to other states for some promising models of that sort of overarching systemic oversight of child welfare. So that's actually going to be the first piece that they've asked us to report on, that discrete piece of work, to provide a report to them in January of 2022. The next part of the timeline will be in March of 2022, providing an initial evaluation report addressing child safety during initial investigation and assessment. And then the third report is due in September of 2022, which will be a comprehensive and final evaluation report on the review that will incorporate that remaining piece on looking at protecting child safety during reunification and permanency. This is actually, I know it sounds like a long time, it's actually pretty rapid for the nature of the work and this nature of the evaluation work that we do. These could be multi-year projects, and we're really working to get things done over the next year with two reports coming out during the second regular session to provide that to the Government Oversight Committee. So that is where we are. We're very actively engaged in, as I mentioned, the preliminary research that we do for all of our evaluations, and really doing some detailed work on planning effectively so that we can meet those deadlines and be efficient in our work going forward. That is sort of at a high level where we are, and pretty much what I can share at this point.
Based on that and what we are familiar with, are there questions? Yes, Representative Madigan.
Thank you, Mr. Chair. Thank you for being with us, Ms. Nixon. As part of OPEGA's work, do you have plans to talk to frontline caseworkers? And if so, is that confidential, and how can their anonymity be assured?
Sure. We are incorporating a survey of frontline workers of DHHS. That is one method that we're actually committed to, because it was something that was already on the OPEGA work plan, was to re-survey frontline workers, since OPEGA did do a survey several years ago. So that is a definitive part of our plan. We do have, and we've done this before, the surveys are conducted as anonymous as possible. The information only comes to us. We use an electronic survey tool that we do not report anything out with any identifying information. We report aggregated information. So all of our work is confidential, and it's reported out in a way that protects the confidentiality of individuals.
Thank you.
Yes, Senator Baldacci.
Thank you, Mr. Chair. Ms. Nixon, thank you very much for the work you're doing. I do have a couple of questions. One, is any of your work going to be directed at trying to strengthen or the role of the ombudsman? The role of the ombudsman, as you know, has no, they have no teeth. There's no legal enforcement. Is there anything in your evaluation that's going to look at that role?
Sure. So I should have mentioned that when I was talking about the oversight panels, I got caught up in that. When I was talking about oversight, I got caught up in those panels. But another key piece of the oversight structure is the ombudsman, and that will be in that piece of work that we're doing, is looking at the authority, roles, and responsibilities of the ombudsman and how that fits into the overall oversight structure. And yes, as I mentioned, we will be looking at any barriers and gaps and opportunities to improve oversight as part of our work.
Okay, and in some of the materials I had read that the safety plans really there's no teeth to those either. And are you going to be looking at I'm assuming that you're going to look at the process of safety planning that's done kind of as a pre-court kind of activity to see how that process works? I mean, I'm assuming that's part of your analysis.
Yeah, so as I mentioned, yeah, safety planning is part of the two key of the three components of our work. And so we will be looking at safety planning both in the initial assessment period and in reunification. And
right. No, but what I meant is specifically there's something called the safety plan contract that typically the department tries to write up with an individual family. So I'm assuming you're going to look at that whole process and see whether that works or whether that can be improved.
Yeah, so that's what I meant as part of looking at safety planning. We would consider that element.
Okay. The only other thing I would add, Mr. Chairman, as general comments, and I think OPEGA is doing a great job, is that I think that the reform issue with DHS has gone on for there's always been a continual issue for over many decades. And I think would be helpful in the scheme of things for us to talk about having stakeholder meetings around the state, because typically how child protection is done in Caribou can differ from how it is done in Bangor or Portland. And because they're run by regional or county offices, and a lot of times these offices have different, while they have the same goals, sometimes they operate somewhat differently with parents. I would encourage us to consider at some point that we bring together stakeholders from around the state and different regions, that we talk to the judges, that we talk to the lawyers involved, that we talk to in addition to the caseworkers, we also talk to the mental health professionals who are typically involved. I think we need to hear from everybody in order to help this process of improving our child protection system. Thank you, Mr. Chairman.
Thank you, Senator Valachi. Representative Perry?
Yes, thank you. I'm going to go back in history a little bit. I do remember that OPEGA had done a study on the child welfare system, again, because of issues of deaths within the system. Are you going to be looking at that to see how far we've come in terms of what was listed as issues? And if those issues have been looked at, and are we looking at a different dynamic? I think we've got to get a feel for not only where we were, how far we've come, but also what are we missing?
Sure, thank you, Representative Perry. It's good to see you. Yes, OPEGA did 2 studies several years ago. There was a case study review of 2 child deaths, and there was a survey of gathering perspectives of frontline workers and supervisors, and that was done by surveys and interviews. So we are certainly looking back to those to see as sort of a launching pad, and also what things we might want to revisit. The nature of this project is, other than the frontline worker survey, which is going to be one component of this project is a bit broader. And those were pretty targeted. So it was the case studies of 2 individual cases, and then just that survey. So we are looking back to those. And as you said, taking stock of where we are now, and in light of what we found before. So I don't know if that answers your question well enough, but that's certainly part of our work, is to look at what we've done before and learn from that and go forward.
Representative Craven?
Thank you, Mr. Chair. Thank you, Lucia, for all your work. So regarding the investigation that you've had for the last 2 girls that had died, are you going to be interviewing the caseworkers that actually worked with those families, as well as current caseworkers?
So we are not specifically revisiting, while I said in response to the previous question, we are looking at an issue level and findings level, what we found in our work in what OPEGA found in their work in 2018 and 2019. We are not revisiting individual cases, and actually our review is not focused on individual case studies this time around. It's we will be collecting data from staff at various levels of the departments and other individuals. We're still figuring out the exact details of that, but as was mentioned earlier in the conversation, is figuring out getting information from other stakeholders and collaterals in the system, whether it's attorneys, mandated reporters, other service providers, but we do not have plans to go back to the 2 cases from 2018.
Are any of the retired caseworkers?
I'm not sure yet how we about accessing prior workers, but we are taking that under consideration.
My question was specific to one that was asked during the GOC meeting about adequacy of resources. Do you and your team feel like you have what you need to be getting this work done? Because that's a potential role for the legislature.
Sure. It is sort of we can make it work. We have a small staff and we have a lot of other ongoing projects. We are prioritizing this. We could certainly always do more with more resources. We are figuring out a way to get it done with the resources that we have. Considering when we get, I think we'll be communicating with the GOC chairs, and also if you wish, we can be in touch with you to the extent that we feel like we are hitting resource constraints that are preventing us from meeting what the GOC has laid out for us. It will be a challenge, but we feel like right now it looks like we can make it work.
And it's also significant work that shouldn't be hamstrung by not having some
Right.
extra dollars.
Yes.
Okay. Will you be signing off now, Lucia, or?
Sure.
Oh, well, I'm not,
Oh.
that wasn't an invitation. I was just asking if you were to stay around, because before you left, I wanted to thank you for your work on getting us our 2 analysts. You've done
Oh.
good. I try and find an occasion to embarrass both of them at least once.
Oh. I was the analyst of HHS when I first went to OPLA in 2003.
Okay. Well, Anna and Aaron have been important to our work.
Yes.
All right. Thank you for being here, and you can do whatever you want. I wasn't trying to disinvite
Okay.
you.
Sure. I'll probably listen in on YouTube for the rest of the
Okay.
afternoon.
Very good.
Thank you very much.
And now we're going to hear from the department about where the reviews stand with what's being done by the department itself and also by Casey Family. So I defer to you all as to who next speaks.
Sure. Yeah, I think Commissioner Lambert will start us off.
Oh, good.
Great.
Welcome,
Thank you.
Commissioner.
Thank you, Senator Claxton, Representative Myers, and all members of the committee. We appreciate the opportunity to be able to give you all an update on child welfare and ongoing activities. So I will turn it over to Director Landry in a moment, but I would like to take a brief moment to comment on the news this week. A 1-month-old Silas Melvin died in Milo, Maine on Sunday. The child's father has been charged with homicide. We mourn every child's death as there's a loss to that child's future, the family, the community, and the state of Maine. And we will work with law enforcement to ensure justice for this child as well as the other children where charges are pending. We notified the Child Welfare Ombudsman about this child's death, a practice we have now newly formalized for every child fatality reported to the department. And in the interest of transparency, today we are posting information on child fatalities reported to the department since 2007. These fatalities include those where the medical examiner has determined that the cause of death is homicide, those where the department has found child abuse or neglect, or where there's a history of child welfare involvement for that child fatality. We are committed to change, and that includes increased accountability. The Office of Child and Family Services has also intensified its work to protect children in Maine, as Director Landry will discuss in today's presentation. But it's important to note that the Child Protective Services is by definition a fallback system. When a family requires intervention by child welfare, it means that other support systems in government, in communities, in families have either failed to reach those families or fallen short of their needs. Children are put at risk by domestic violence, substance use disorders, mental illness, generational poverty, among other factors. The Department of Health and Human Services scope includes a number of programs whose purpose is to address these problems. This is why, in addition to the work to improve child protective services, we continue to improve and expand services that support families upstream. For example, we have used coronavirus-related resources from the federal government to expand quality childcare, to increase payment rates in Maine Care for Behavioral Health Services. We have extended and expanded the scope of the Strength and Me campaign, a disaster response program targeting the unique mental health challenges of the COVID-19 pandemic and its impact on children and families. And we are broadening crisis services in the state of Maine to ensure that rapid and effective services can be provided to prevent escalating violence and harm. Our primary goal is prevention. How do we prevent the need for child protective services in the first place? We hope to soon get federal approval for Maine's Family First Preventive Services Act plan that makes those upstream investments possible. We'll be using these resources to provide tools and supports for families to care for and nourish their children. That will help us improve and initiate services across the spectrum to fulfill our responsibility as a department and as a state to protect our children. Every Maine child should have the opportunity to grow and thrive in a healthy family and community. These recent child deaths are a call for action, for urgent yet deliberative action. So we look forward to your input on the ideas that we're presenting today, as well as your partnership in this work. With that, I will turn it over to Director Landry for the presentation.
Thank you, Director.
Thank you, Commissioner, Senator Claxton, Representative Meyer, members of the committee. Thank you for the chance to provide this update to you today. I do have just a short presentation with some information that we've been requested to provide that will include an update on where we stand with the review process, specifically the review process that we've undertaken with Casey Family Programs. We'll also provide you some contextual information that some of you have requested of us as it relates to child safety and child welfare. And with that, I will share my screen and hopefully, Molly, can you see the screen? Thank you. So I did want to just start off briefly by just sharing within Child Welfare Services, efforts have been undertaken in the past 2 to 3 years to improve practices. Some of these, certainly not all of them, but some of these efforts are summarized on this slide. These system improvement efforts are all tied back to the overall goal of child safety and well-being. Some of them are focused on supporting our OCFS caseworkers, such as coaching and clinical supports. Others are achieved in collaboration with the judicial system, such as the updated reunification plan. And still others are directly about child safety, including the establishment of the background check unit. And while this list does not capture everything that's been put in place, I think it does provide you with a representative sample of some of the efforts over the past few years. This slide it also gives you a few more details about some specific examples of the efforts that have been implemented. Again, it's not an exhaustive list, but a few examples for your information, including an implementation of a permanency review process for children in care, which I think has already shown some very positive efforts towards moving children to permanency. Since September of 2018, OCFS has certainly benefited from several initiatives which have increased staffing within child welfare, including new caseworker positions, new supervisor positions, and support staff lines. These new staff have made a significant difference in OCFS's ability to provide quality child welfare services in the state. I think it's important to note that these new staff positions have been and will continue to be a great resource. At the same time, the increase also means that the average tenure of our caseworkers and supervisors has decreased. We know from what our caseworkers have told us is that it takes up to 1.5 years to become proficient in their roles. So our focus, particularly for new caseworkers and new supervisors, is to work towards consistent practice and consistent policy implementation across the state. And that's a particular challenge sometimes for newer caseworkers and newer supervisors. Over time, I anticipate that consistency across the state will improve, which will drive better outcomes and results. Also linked into this, in addition to those efforts that I noted previously, I want to call attention to policy and training improvements made in the past 2 years. Our work with the Cutler Institute at the Muskie School at USM continues to develop and implement new and revised trainings, including new training for our resource families, as well as updated training for our staff. That work continues, and as you'll hear in a moment, will be increased in certain areas in the coming year. In the meantime, as I believe all of you know, we have engaged the national expertise of Casey Family Programs to provide recommendations as they review the recent high-profile cases that you are familiar with. Several of you have asked about how Maine compares to national benchmarks or in comparison to other states. In addition to federal benchmark measures, 3 of which are on our public-facing dashboard, we also have the benefit of comparing Maine to other states on a variety of data measures, and I'm offering a few of those for your context today. One of those that you see on this slide is the rate of children entering care based on population. And as you can see on this chart, Maine has a current rate of children entering care as of 2020 of 3.6 per 1,000 children in the state population. So put another way, that's 0.36%. And you can see here that this is slightly above the national average. One measure where Maine is considered a national leader is the percent of children in care who are in a congregate care setting, sometimes called a residential setting. As you can see, Maine has the lowest rate of children in congregate settings in the country. Conversely, this also means that Maine has the highest rate in the country in placement of children in care in family or home-based settings. And clearly, that's always the preferred place, type of placement if possible. And one additional piece that's absolutely critical that we all recognize is placement stability. So once a child comes into care, ensuring that they have that placement stability. This chart shows how Maine compares on placement stability versus other states in the country. You can see that this chart shows that Maine has a slightly higher rate of stability. Translated another way, that means a lower rate of child moves versus the national average. So again, this is a chart where the lower number is better. And you can see this rate of placement is calculated per 1,000 days of foster care of all children who enter care in a 12-month period. So this gives you some feeling for that as well. Regrettably, child fatalities do occur in Maine and across the country. Some of you have asked how Maine compares to national averages on child fatalities, and I have 2 slides that demonstrate that comparison. This table shows the total rate of all child fatalities, regardless of cause. As you can see in 2019, Maine's rate of child fatalities for all causes was 14 per 100,000 children in the state population. And this compares to a national average of 16 per 100,000 child population. The federal government also has us collect or request data from each of the states on child abuse and neglect fatalities or fatalities that had a potential tangent or connection to child abuse and neglect. So when we examine and look at only those child fatalities due to child abuse and neglect or have a impact from child abuse and neglect, it shows that Maine has a rate as of 2019 of 1.2 per 100,000 children in the state population. That compares to a national average of 2.5. So put another way, Maine's child fatalities with an impact from child abuse and neglect are about a half of the current national average, or was as of 2019. This data comes from the Federal Administration of Children and Families, otherwise known as ACF. As you may note, Maine chose to not report data for the federal fiscal years of 15, 16, and 17 during the last administration. Would like to turn now to Casey Family Programs and our work with them and their partners at Collaborative Safety. Their national expertise and perspective was one of the key reasons why DHHS invited them to work with us on the review of recent cases. Casey and their partners at Collaborative Safety have been working since mid-July on the review. I'm pleased to say that they're on track to complete their work in the 90-day period that we requested. Specifically, the project timeline looks like this. A snapshot is shown here on the chart. Last week, the systems mapping stage was conducted with 3 days of on-site review that involved OCFS caseworkers, supervisors, and management. Also participating in the process was the Child Welfare Ombudsman and a staff member from OPEGA for all 3 days of those reviews. We also have representatives from law enforcement and for certain cases, ARP provider staff. Feedback on the system mapping component from all of those that participated, including the Child Welfare Ombudsman and OPEGA staff, was very positive, and they all felt that the process was beneficial to a greater understanding of the cases, which I believe is going to lead to better or more informed recommendations from Casey and their partners. The system mapping component is going to be wrapped up in the next week or so. And then Casey Family Programs and their partners will progress to the data analysis stage before completing their work with case presentations and final reports. That work will include recommendations from Casey Family Programs, and those recommendations will be made public at the conclusion of the project in October. Right now, they're right on track for that 90-day time period, which would be right at mid-October. I'd like to conclude with a short look at the future of some of the activities that have been planned and prioritized for the coming weeks and months. The cooperative agreement with Muskie will continue to focus on updated policy, implementing a field unit and building a cadre of students to more easily transition into caseworker roles. Muskie is also going to prioritize the development of a full continuum supervision framework with updated supervisor competencies and training. We certainly believe, as many of you I know do as well, is that the supervisors are absolutely key to solid best practice in the state, and focusing on supervisor training and supervisor competencies and updating that framework and training, I think, is an essential step forward for us. We're also on track, as Commissioner Lambrou indicated, to implement Family First this fall. I believe it could be a transformational approach to working with families and children, specifically families with children who are at the imminent risk of their children coming into the foster care system. My thanks to this committee and to the full legislature for their support in the past 2 legislative sessions toward Family First implementation. And I know we look forward to, as I know all of you do, to the recommendations from Casey Family Programs and their partners to further improve and build upon our identified child welfare strategic priorities and implementation plans. As I conclude, I'll simply say thank you for your time. I appreciate the opportunity to give this information to you. We've also shared information for you in the appendix to this PowerPoint that I believe has been shared with all of you. I'd be happy to discuss any questions that you have about anything that was in that appendix, whether that's at today's meeting or following today's meeting. And with that, I'll discontinue sharing my screen and see if there are any questions from me.
Looks like there are several people with questions. Let's start with Representative Madigan.
Thank you, Mr. Chair, and thank you, Commissioner Lambrou and Dr. Landry for being here. First off, I want to thank you both for increasing transparency as far as releasing that data that have to do with child fatalities, and also kudos for being the first New England state to get a Families First Prevention Services Act plan into the feds. I do have some questions that I hope you can answer. How many children, I guess I'm wondering, how many children do we have being in hotels? And I understand that sometimes there's difficulty in children being, finding an appropriate safe foster home placement for them, a safe foster resource family. But do we have any data on that and what the average length of stay is, and what's the longest length of stay in that?
And Representative Madigan, I'm pulling up some of our most recent data on that. Can you, are you looking for information? I didn't quite hear where you're asking the children are. Did you say
That are
hotels?
being housed in hotels with
Hotels.
DHS supervision.
Sure.
Because
Sure.
there's not an appropriate, safe resource family placement for them at the moment.
Yes, understood. If you give me just a moment, I'm pulling up our data on that. I can tell you happy to provide this data to you back. We've been tracking this since I believe back to 2019, October 2019 to the present as we've been tracking this. So I'm happy to provide this to you because we have provided it in the past to OPEGA. I can tell you as of July, at any point during the month, there was a total of 4 children that were in a hotel that were in state custody. So 4 children, that equates to 0.2% of children in state custody. Total number of nights for those 4 children were 50. So the average nights per child was 12.5. I can tell you we have one youth in particular that I know that has an extended stay in a hotel, and we're working diligently to find a safe, appropriate placement for that youth. And so that has skewed it to a certain degree. I can tell you just real quickly from March through June, the total number of children at any point in time in a hotel in March was 2 children or 2 youth. In April was 1. In May, we had 0. In June was 3. And as I indicated, in July was 4. So that is that specific information for you.
Thank you. And I have can I continue?
Sure.
Okay. I'm going to ask a little bit about caseloads because you brought it up. And what I'd like to know is how the average caseload is calculated, how you guys do that. I mean, each within OCFS, there's different units, there's the intake unit, assessment unit, permanency, all that. Do all those units carry a caseload? And I guess I want to know how it's calculated, because in my talking to folks, what I hear is that there are some folks who still have very high caseloads. And I understand the challenges, the workforce challenges and all that. And I understand that, in the midst of, more substance use disorder problems and the middle of a pandemic, it's difficult. But I have great concerns that you guys, I can be a broken record on this, right? That one of the best things we can do is make sure that caseworkers have reasonable caseloads so they can complete their assessments and everyone can make the best decision regarding safety for children.
Yes, Representative Madigan, and I agree with you completely. I think, as you know, we've been doing and providing to the legislature annual workload reports that detail that. To your point, you're exactly right. A caseload of 10 for one worker may look very different from a caseload of 7 or 5 for another worker, depending upon the challenges associated with those individual cases, the number of children that are in that family, et cetera. So we tend to focus more on workload versus caseload from the analytic tool perspective. However, we do track on a weekly basis caseload numbers. And so we do track that based on a few categories. As you indicated, we have investigation or assessment workers, and so we can easily calculate that number. That average caseload as of last week, I believe, was 8 across the state. However, there are variations depending upon which district. And I want to be clear about that. We also look at caseworkers who are just having a permanency caseload. So those are children who are in the system that are going through initially a reunification process. The average caseworker or caseload for those is approximately 10. But again, there is variation across the state. And I will tell you there's variation within districts, depending upon unique characteristics of those cases. Adoption caseloads tend to be a bit higher, and one of the reasons for that is both assessment or investigation and permanency a caseload is per family. And so we're looking at the family there, which could have one child or multiple children, of course, in the family. When it switches to an adoption caseload, those are counted per child. And I believe our average caseload for adoption caseworkers right now is approximately 15. And so again, there is variation across the state on that. And then last, we recognize for some of our staff, particularly those in some of our smaller offices, they have a mixed caseload. So they're not just a permanency worker, they may be permanency and adoption, or they may be adoption and an assessment, or vice versa. The average caseload for our mixed caseloads for those staff who fall in that category is 10, approximately 10, again, with variations across the state.
Thank you. And I have just one last one. The contract for visitation, for child visitation, was canceled, ended, as far as I know. So I'm wondering about the department's plans for continuing visitation. That's certainly important, in issues of family reunification. It's important for those visits to be supervised when that is determined to be in the best interest of the child. And so I'm wondering how that's impacting children and workers. Since they're more responsible now for transportation, arranging and supervising those visitations.
Yeah, I certainly appreciate the question. The visitation contract was, the prior visitation contract ended according to its schedule, I believe in 2020. It was re-RFP'd out, and based on that RFP, there were changes in who holds those contracts, and that happened in 2020. The process was not without some challenges. One, because we were doing that RFP and that change during the pandemic, which certainly caused some significant challenges. The other thing that delayed some of those situations in a couple of the districts was the fact that there was a rather extensive appeal process by contractors that that were not selected during the RFP process. And so that delayed some of the implementation of the new contracts as well. That appeal process has completed. It was completed in 2020. And so since the second half of fourth quarter, I would say, of 2020 and into 21, we have transitioned to the new contract holders for all of those contracts on a statewide basis. The timing of that, of course, has been a bit challenging for the new contractors because of the impact of the pandemic, as well as some of the challenges regarding workforce. And I don't think it's a surprise to any of you that, we have workforce challenges in many fields and in many areas of the state. That certainly has impacted those providers as well. And that certainly has been felt more acutely in certain of our districts. I would say D4 is one of those districts. District 4 in our Rockland area has certainly had more challenges with the new contract provider coming up to speed versus other contractors, say in the southern part of the state, that have had a bit of an easier time transitioning into those new contracts. We're working through that process with them. We are on a daily and weekly basis checking and working with them on changes to their process, where they are in hiring staff, et cetera. Certainly, we're going to continue to monitor their performance. And if the performance does not improve, we certainly will consider and certainly could consider ending those contracts or not renewing those contracts on the tentative schedule we have put together. And if we need to, re-RFP those contracts in order to get the services that we need.
Thank you.
Senator Moore?
Thank you so much. I appreciate that. And thank you both for being here. One quick question I was thinking about was, Opega mentioned that they are not looking at the individual cases of these 4 children that have lost their lives. Is Casey, I know that they're going to be giving us recommendations and looking at the overall process, but are they also looking at these 4 individual cases as to maybe what we did wrong or what we could do better?
Yes, and that's exactly what we've asked Casey to do, is we've asked Casey and their partners to, and that is the process that they're going through. So when I talked about the system mapping approach last week, those were the specific cases that they mapped out the system impacts, the system challenges, where there are learning points, where there are, for lack of a better term, inflection points of where, you know, improvements could be considered. So they're looking at the individual cases, and they're also then taking that and extrapolating it out to the larger system of policies and practices for recommendations that we can consider going forward. So it's really looking at our practices and policies through the lens of those cases, but it is a combined approach. So yes, they're looking at it specifically in those cases. That's what their system mapping, that's what they are looking at learning points, and then extrapolating them out to larger system recommendations. Hope that answered your question.
It did, Dr. Landry. Thank you. Now, do you think that they'll also, I mean, I know they were a little further, but take a look at what's happened with Silas and this recent death?
Well, one of the things that we have talked with them about is we asked and they made a commitment to get those recommendations and those reviews done of the prior cases in the 90-day period. Right. We don't want to take them away from that, because I know we all have great interest in getting those reports and recommendations back as quickly as possible. So we have not at this point asked them to take a look at the case that you're referring to. However, we certainly may ask them to do that after they've completed these initial reviews. So it is something that we are considering. The other thing that I will tell you that we are considering, and something that the Ombudsman and I have had several conversations about, is the possibility and consideration of taking the system that we are we are using or currently being used with Casey and Collaborative Safety, and perhaps embedding that system into certain reviews on an ongoing basis as we go forward. As I said, there was a lot of enthusiasm for the process that Collaborative Safety is using with Casey, and I think there's potentially some interest in replicating and implementing that similar process for certain cases in the future. So I think we do have some opportunities, and that may be one of the recommendations that Casey suggests that we consider. And certainly, I don't want to pre-assume anything, but that's certainly something that we're open to.
Well, and it might even give us a template somewhat in our investigation, saying that, this is what happened. You might look at this, and this because of what we found in our review. So that's good.
Exactly. And one thing, if I may add, that's along those lines is Casey and the partners have certainly indicated a willingness to meet with this committee once their recommendations are complete and their process is done. They can certainly describe for you more details about their specific science safety approach that they take towards reviewing these cases, but it is taken from the aviation fields, manufacturing fields, and other fields where they have critical incidents as well, and have an absolute ongoing need, of course, to learn from those. And so it is a very science-based, safety science-based approach that they take. And again, I think there could be some opportunities for us in considering the use of that approach in the future.
Thank you.
Representative Zager.
Thank you, Mr. Chair. And I want to first thank Commissioner Lambrou and Director Landry for all the work that your department that's being reported on. My question, Dr. Landry, is actually from a very interesting graph in the appendix, in which you illustrate the year after year increase in the youth in DHHS custody. It shows from 2017 to 2020 pretty significant increases, and then there's a little downturn so far. We don't have a complete year of data for it's an October to October comparison. But my question, I guess, is why the year-to-year increase, and then why the most recent decrease, wondering if this is related to the opioid epidemic, if this is related to as a demand side thing or versus a supply side thing of funding or staffing availability and the capacity of the system that the legislature is permitting.
Representative Zager, thank you for your question. I think there are two primary driving forces in the increase from 2017 to 2020. One that you exactly, and I think correctly point out, is the impact of the opioid crisis in our state and across other states. Nationally, the states that have had a greater impact of the opiate crisis, so specifically some of our New England states, as well as some of the other states, where the data shows that there's been a bigger increase in opiate usage, opiate overdoses, et cetera, there has generally been a corresponding increase to the number of children in care in that state's child welfare system. So I think that appears to be a pretty undeniable trend and correlation as well. So I think that's one piece. The other piece that is also absolutely true is the data and the research is very clear that whenever there are high profile cases of usually child fatalities, certainly what Maine experienced in 2017, 2018, what you typically see is greater societal awareness and understanding and concern about children who may be at risk. You generally see more referrals coming into the Public Child Welfare Agency, and you generally see an increase in the number of children coming into care. And there's a lot of theories about, specifically why it translates across all of those pieces that I'd be happy to have a separate discussion with you in respect of our time commitments today. But generally speaking, those are correlations and trend lines that you see in other states when similar high-profile cases have happened. So to a certain degree, from my view and my opinion, is we've got both of those things impacting Maine. Significantly, the opiate issues and challenges, as well as the impact of the knowledge level and the awareness in society via those high-profile child cases.
Thank you. And one quick follow-up, Mr. Chair.
Please.
With regard to capacity, you talked about the Muskie School's planned field instruction unit. What is the proposed yield of that? Are we talking about a few or a dozen, or how many folks might be additional caseworkers from that?
It's a good question. We are working with Muskie right now on the specifics of that approach. We're looking to put that in place as quickly as we can, as soon as this current fall semester. So I think we'll start off relatively small, probably with fewer than 20 across the state. But I'd like to see that number grow over time, because there was in the past, I believe, a field instruction unit that the department had a partnership with the Muskie School on. It was successful. I think it was done away with somewhere in the last 10 years prior to now. And so we're reinstituting it. Certainly it won't be exactly the same. We've been able to improve it, I believe, and put in place even a better system and approach. But ultimately, I do think it's a fantastic way for students who are interested in the field to be able to learn about that. And I think the more that they learn about it and the more education information they have, we certainly believe they'll be much more likely to become full-time caseworkers, which will give us that essential pipeline of new staff that come in.
Thank you very much.
Representative Stover.
Thank you, Commissioner, and thank you, Director Landry, as always. I had a question similar to one that was asked earlier, similar in the question of how many children, but mine is specific to emergency departments, because I've had locally where I live, sort of in the mid-coast area, calls over the past few months, but increasing number of people in general, including adults with mental illness, but also children having long stays. And I wondered if those were children in custody or children who are being brought to the attention of the department, if you have any information about that. Thank you.
Well, we track both. I mentioned the hotel data. We also track the emergency department data. What I can tell you is similarly, we have seen in the last 2 months an increase in the number of children who have spent any time in an emergency department during the month. So I want to be clear, there's lots of reasons why a child can go to the emergency department. There could be medical reasons, there could be, as you point out, behavioral health reasons. There could be, lots of reasons why, why a child goes to the emergency department. What I can tell you is in the month of June, at any point during the month, we had 7 children in state custody that visited or were in an emergency department. In the month of July, that number increased to 11. And I can tell you as well that the average nights per child for those 11 youth, the average was 7 nights. And so that is an increase versus what we had seen earlier in the year. For example, in February, we had 4 youth in custody that were in an ED at any point in time. The average nights per child in February was 2.8. Again, I'm happy to share this information with you after the meeting. I do know that we have had, particularly in the month of July, and I would also say in the month of August, we had, again, 1 youth in particular in the Down East area that has been particularly challenging to place. And so we are working diligently on that piece as well. I would also say that one of the things that we are working on that impacts not just children in care, because as you mentioned, there are also youth that are not in the care and custody of the state that may be waiting in an ED or maybe in an ED waiting for placement, whether it be hospital bed or a community placement. I am happy to say one of the things that we are implementing, and in large part it's due to new federal funding through the CURSA funds, is we had implemented in 2020 to 2021, July to June of 21, we had implemented an aftercare crisis pilot in partnership with AMHC in Aroostook County. What we saw in that 1 year of work in that crisis pilot was a significant reduction in the number of children waiting in the ED, as well as the number of times they returned to the emergency department. Because of the success of that pilot, we're now using some CURSA funds that became available to us through federal relief dollars. And effective July 1, we have implemented that program on a statewide basis. So we now will be doing that crisis pilot statewide. We'll be evaluating those results. And I believe it's a really good use of CURSA funds to really test out this pilot on a full statewide basis. If it's successful, then certainly we'll be wanting to talk about how we can continue that program. But we've got the funds now in place for the next 2 years for us to do a careful evaluation and look at that pilot. My hope is that's going to significantly help not just the children who are in the care and custody of DHHS, but all children who may have some of those challenges and sometimes can end up waiting in an emergency department for a placement.
Thank you. I just want to say thank you, Dr. Landry, for that information, and that it makes me happy to know that it's going to be statewide. I think that's great.
Senator Baldacci.
Thank you, Mr. Chairman, and thank you, Commissioner Lambrou, and thank you, Director Landry. I very much appreciate and greatly respect the work that you're both doing to protect children and families. One of the questions, my biggest concern, and I think it goes to the part that we're all concerned about, is about these children's deaths, is having an adequate early warning system in place. One of the factors in that is having more public health nurses. I know we just started rebuilding that system, but public health nurses in many communities do, as you know, the check-ins with young families can provide important assistance, particularly in that transition from hospital to home. What are we doing to expand public health nursing check-ins? And as a second question on the early warning system. I note that the person charged in the murder in Milo had like several domestic violence records. Is there a, my concern, Director Landry, is being able to work together with so many different providers to have an early warning system. Like, I don't know if this gentleman came across the radar screen in Piscataquis County or not. And hopefully we can learn from our mistakes. And when I say our mistakes, I'm talking about all of us as a state. I think the department does incredible work overall, and sometimes that gets missed, but there's always room for improvement. But my biggest concern is having a better early warning system, because the most critical decision sometimes in these cases is to decide whether they should be going to court or whether we can work something out with the family. But the family has to follow through with it. But so I just want to ask about the public health nursing and about how we can better focus on this early warning system. Thank you, Director.
And Senator Baldacci, maybe I'll begin, and I think as a reminder,
sure,
because there are ongoing active law enforcement investigations in this particular case. We can't speak to the individual circumstances of the child in Milo, but let me talk a little bit about public health nurses and the kind of systems that we're trying to create, again, with the help of some of this coronavirus relief funding. So the department did get from the US CDC a public health workforce grant that is about $8 million. Part of that will go to bolstering our both public health nurse team as well as our regional district public health workers. You know, we used to have a much more regional system in terms of our on the ground support for public health, and we're hoping to expand that through some of these funding, through some funding. We also were in close collaboration with the Department of Education because we know that some school districts have their own school-based health clinics, some have nurses and some don't. And so we are going to take the opportunity of some of this federal funding to figure out how we can strengthen that system, because we do know that, again, going to early detection system, our schools, our childcare, our pre-K sites are all critical parts of that safety net for children. And we're hopeful that by really building out not just our school nurses, but also our school behavioral health programs, really build that into the fabric of our school-based health programs, as well as oral health and public health. We're hopeful that these new resources will expand those types of early warning systems. But Director Landry, do you want to add anything to that?
Yeah, I'll just add one additional piece to that, and that is I do want to reference our Family First plan that we intend on implementing on October 1st, as you heard, waiting on final federal approval of that plan. But one of the components, and Senator Baldacci, it is not PHN, and so it's not public health nursing, but a similar type of home visiting approach is through Parents as Teachers, the PAT approach and PAT program. Very happy to say that our plan includes an expansion of the Parents as Teachers program in partnership with Maine CDC in order to make those services available to more families, specifically in this case, families who are at imminent risk of their child coming into care. I think it's one of the best examples, that as well as the home builders implementation that we'll be doing, of new services or expanded services that we'll be able to implement through Family First. One of the big differences, I would say, and I believe the question may have come up before in a question to Dr. Nixon, was related to service cases, as we sometimes call them. I think it may have been a different term used there. And so in those service cases, all of those service cases that we currently are doing will shift to become Families First prevention services cases. And in those, there'll be a much more formalized approach towards monitoring and managing those cases, as well as much, I believe, a higher accountability as it relates to the families and the providers and the follow-up to ensure that the services are being delivered. And if the services aren't working, to make sure that we know about that so that, in fact, we can consider a different approach in either working with the family or having those children come into the care and custody of the state through a preliminary protection order.
Representative Meyer, you have had a chance to ask a question yet?
Thank you, Mr. Chair. And thank you, Commissioner and Director, for your flexibility today too, as our schedule got pushed out. Quick question on what the department might be doing with regard to a current review of cases in light of the pediatric tragedies.
Representative Meyer, thank you for that question. And I do want to point out that in addition to what Casey is doing in the review of the cases, OCFS certainly does an internal review of every one of these cases. That is usually in almost all cases led by one of our regional directors who does a comprehensive review. That review information is shared with various individuals within OCFS initially, and usually includes the commissioner and commissioner's office staff as well as then a debrief opportunity so we can look for those opportunities to learn from any of these cases. And I do want to point out, it's not just potentially child death cases or fatality cases, it's other cases as well that we target and look at to do those kind of comprehensive reviews on. We are doing those reviews. We have completed them in some cases for some of these cases. In others, as you might expect, we've just begun. But we have implemented some practice changes, and this is on an ongoing basis. So it's not related to any specific case, but on an ongoing basis. So for example, I'll give you just one example in July. In July, we issued some clarifying guidance and information to all of our caseworkers as it relates to trial home placements. So a trial home placement, for those of you who aren't familiar with it, is when a child is in the custody of the state, but with court oversight and court direction, the child is placed back into the home for a trial period towards hopefully successful reunification. Again, that's done with court review, court oversight, and the involvement of the guardians ad litem, as well as parents, attorneys, and the department. But we have sent out some additional clarifying guidance to staff about the expectations that we have for trial home placements. So I'll give this as an example to you. We have reiterated the need that the caseworkers, as always, we will see the children and parents at a specific frequency in those trial home placements. So specifically, that will mean that they will have weekly contact with the parents and children for the first 6 weeks of that trial home placement. In addition, there'll be bi-weekly contact with parents and children for the following 6 weeks. So it's a 12-week period of time. At least one of those visits per month will be on an unannounced basis. And again, I believe, that's just an example of when we do some of the reviews and we learn from those reviews. And it's not usually just one case. We're usually looking at sometimes multiple cases that may or may not have involved a fatality. We issue on an ongoing basis this additional training, information, and guidance to staff. So I use that as just one example. There are several that I won't go into given our time today, but that's one example of the way that we use the ongoing quality assurance and review process internally to move practice forward. And now we believe that'll be augmented by these additional reviews and recommendations from Casey.
Representative Madigan.
Thank you, Mr. Chair. I had a follow-up. I recognize, that the department is operating under the same workforce challenges that other employers, have. And certainly when you've talked about, in adding staff and things like that, you have those challenges. One of the things I'm concerned about is I know the number of children that are being housed in hotel rooms is small, compared to the overall total of children in custody. But it's alarming to me for a couple of reasons. One is that these are children that usually have disabilities, behavioral health challenges in some way. And the people most in charge of spending time with them are often our DHS caseworkers, who aren't necessarily trained as behavioral health professionals. I mean, they're trained to be child protective workers, and they do a great job at that. And this is kind of I see this as a systemic issue. And I see it as something that's potentially traumatic to children, which of course can lead to poor outcomes down the way. And so I'm wondering kind of how we can address those challenges. And, as far as other placements, I know in the past we had bridge homes. I'm not suggesting we go back to that. But I think something better than a hotel, which is really not a family place for a child to be, and quite dangerous in some ways.
Representative Madigan, I appreciate it. And you're right. I agree with you that that certainly while it's a relatively small number in the total percentage of the number of children that are in care, whenever you have a child waiting or being placed in a hotel room, using your example, that certainly has for lack of a better term, an outsized influence and impact on our staff, without a doubt. And I agree with that 100%, especially if it's a particularly challenging placement and it tends to, or it can go on for longer than any of us would like. Ideally, of course, we don't want any youth to be in a hotel at all. We always want our youth to be able to be placed in a safe and an appropriate placement, preferably in a home or a family, setting. It's one of the reasons why I will say that I'm happy to say that despite the impact of the pandemic over the past 2 years, we've increased our number of resource families by about 30%. That's really positive, and I'm very happy and grateful to the work that everyone has done in order to continue to recruit and train resource families despite some of the challenges of the pandemic. Nonetheless, there are times when there are certainly some youth who may be more challenging to place, or we may have some challenges in one part of the state, but the resource families in a different part of the state. So you have some location or logistical challenges as well. I think in the near term, we're continuing to ramp up our services to recruit more resource families. We certainly are working with some of and continuing efforts to work with our existing resource families to become therapeutic foster or resource families so that they can handle some of the more challenging behaviors or situations that come to our attention. And this is where I think we have some good opportunities within OCFS with the linkage with children's behavioral health. Because for a small number of our children, particularly those in an ED situation, certainly the more that we can rebuild and accelerate the rebuilding of our children's behavioral health services is going to help to mitigate those challenges as well. So it is an ongoing effort. I will say that generally speaking, when we look at the data over the course of a couple of years, we generally see a bit of an increase in the early fall when school generally goes back into session. We are certainly, I think, and to a certain degree in anticipation of return to school, we tend to see this little bit of an increase. And that certainly was true last year, and it's true this year. In the month of July and into August, it tends to peak. I will tell you from last year's data, it tends to peak in either September or October before it normalizes back out. So we're trying to get out ahead of that curve to the extent that we can, but recognizing there are still limitations and challenges. So the commissioner and I met with we've been having some district town hall calls virtually. We had 2 of those last week with District 6 and District 4, so specifically the Bangor district as well as the Rockland district. Particularly in D6, our Bangor district, they've been challenged a bit with a couple of these youth situations, and we're doing what we can to try to assist with that. But you're right, there are some limitations, but hopefully I've given you some examples of what we're trying to do both near term and long term.
Thank you.
Senator Moore?
Just one real quick question, Dr. Linder. Do we have any of our children that are in state custody that are out of state for placement?
Yes, we do. In some cases, those children are in out-of-state placement with relatives. So again, sometimes we want to place them with relatives whenever we can. And so following the Interstate Compact for Placement of Children process, which is a federal guideline, sometimes we have children placed in those situations. We also have, I believe and I'm working from memory here, so I can work to get you this specific number. I believe we have approximately 20 youth that are placed in out-of-state residential settings. I believe all but 2 of those are in New England, with most of those in New Hampshire. And so we do have some that are placed out of state from a residential treatment perspective. So we have both categories, both placed with relatives in homes or in a pre-adoptive placement, for example, out of state, usually with a relative, or we have a small number that are placed in residential.
Great, thank you.
Representative Stover.
Thank you again. Dr. Landry, you had mentioned earlier, and I think it's come up a couple times between all of us, that all jobs across the state are having difficulty, all employers. I'm just wondering, given that, how many caseworker vacancies do you have right now, as well as supervisors and PAs, or maybe you call those regional directors now? How many vacancies do you have across the state?
It's a good question, and similar to what we've experienced in other fields in the state, I can share with you we have seen a slight increase, a bit of an increase in our number of vacancies. For much of the 18 months of the pandemic, we were averaging between 8 to 12 vacancies of caseworkers out of approximately 450 total caseworkers. So we had a very low number of vacancies. I can share with you that in the past 2 months in particular, we've seen a bit of an increase. Now, I'm working from memory here, but I believe we have about 22 vacancies right now. And that's statewide, again, of about 450, I believe, total number of caseworkers. Supervisors, I believe as of last week, we had 2 supervisor vacancies in the state. And I believe as of right now, we do not have any program administrator vacancies or assistant program administrator vacancies.
Thank you.
I would also point out, and it's up fresh on my mind because this topic came up this morning, on a biweekly basis, the 6 New England states meet together, all of their child welfare directors or commissioners, depending upon what they're called in the different states. We had one of the meetings this morning, and that was the #1 topic for all 6 of the New England states, all 6 of them. I believe it was, well, I won't say because I'm working off of memory here. One of our New England state, counterparts with approximately the same number of total caseworker positions reportedly had 50 to 60 openings. And so I think we are doing slightly better than some of the other states, but it doesn't change the fact that we want to have as few vacancies as possible. We absolutely want to get those positions filled with qualified staff, get them trained well, and then give them the support that they need so that we can continue to have our relatively low turnover rates, which as of the last data that we shared with you was about 15% annual turnover.
Thank you.
Finally, I get a chance to ask a couple questions, Dr. Landry. Related to proficiency, you talked about 1.5 years for folks to get good at it. Do we adjust the number of cases per person early on in somebody's career? That's what I figured, but
yes, we absolutely do. And that's why the averages that I provided, I believe, to Representative Madigan are simply that. They're mathematical averages.
Sure.
A newer caseworker is going to have, generally speaking, a fewer number of cases, whereas a more experienced one is probably going to have a larger number of cases, depending upon what the needs are in that district, what the demands are, et cetera. But generally speaking, newer caseworkers work into a higher or an average caseload, whereas more experienced ones may end up carrying slightly above that average.
Do we have a way to risk stratify the circumstances of the children in our care? Do we have a way on the initial intake? Is there a score that comes out of that, or an ongoing reassessment that would allow us to then go back and review our top 10 and our next 10 and our top 25%, trying to anticipate some of these problems?
We do. One of the tools that our staff have is the SDM, Strategic Decision Making Tool, that our staff use at all stages of the case. I do want to emphasize it's a tool. It's not if I could rename it, it's copyrighted, so I can't. But if I could rename it, I believe a better name for that would be strategic information as opposed to strategic decision making. It's really about more information for the staff. And so we certainly use the SDM tool. It's then reviewed by supervisors before any decision is made at any stage along that process. Just because the tool, recommends or generates a certain, level or recommendation doesn't mean that we follow that. It can and is on occasion overridden, if you will, or a different decision made. But it's a tool for us to use. So if we, for example, if there's a recommended decision out of that tool and the thinking is that we want to change that, then it's really about the conversation discussion that the team should have with the supervisor, the caseworker, and others to say, why is it that we're seeing this differently? Because that's usually the benefit of many of those pieces is the team decision-making approach, which we implemented about 2 or 3 years ago that we continue to focus on because certainly, particularly for challenging cases, we need to have more than one person obviously making some of these decisions and informing those decisions.
And my other question, last question, was about perception and reestablishing a higher level of credibility. Have we thought about contracting with Casey to come back in 2 years or 3 years and say, how are we doing with the recommendations that you made in 2021? That kind of commitment going forward might carry some weight too.
I appreciate the suggestion. I have not had those conversations yet with Casey Family Programs. We've really been focused on the 90-day project that they have committed to us to complete. But it's certainly something that I'm happy to take forward and for us to consider looking at going forward, because I do believe that one of the things that we have to focus on is the trust and credibility with OCFS, with our staff, and with the entire child welfare system, recognizing that it goes well beyond OCFS or the Public Child Welfare Agency. And so I appreciate the suggestion, and it's one that we will certainly take under consideration.
And the department has such incredible tension in my mind between the want to keep kids out of foster care and back with their families, balanced against the risks to the kids and wanting to keep them safe. So that seems to be which child do you love the more? It seems to be a really stuck place and a lot of tension around that. And I'm just trying to anticipate that when those hard decisions are made, there's been good foundation and a good explanation can follow.
You're exactly right, Senator Claxton, and I think other stakeholders would certainly share what the opinion that and belief that I'm going to share with you is when you make a decision to potentially go to a court or go to a judge and ask for a preliminary protection order to take a child into custody, there has to be the recognition that that act of a child coming into custody and being removed from their family, causes a certain amount of disruption. Some would say a certain amount of trauma for that child and that family. We certainly don't want to create any more challenges or trauma for a family than they may already be experiencing. So that is why I think we have to focus when we make those decisions on child safety first and foremost. But it is rarely are these decisions clear cut. Rarely are these, in some cases, maybe a few cases, the decisions are quite straightforward and very clear. Those are not the ones that challenge our staff or would challenge any of us. It's really these much more complicated challenges and answering and addressing that question of whether or not, with the appropriate services and supports, a child can safely stay in their home, which is what we would all agree is the preferred outcome. The key part of that is being safely be able to stay at home.
Right.
But if that can't happen, then we need to take the action of going to a judge and asking for a preliminary protection order and taking the child into custody. But it is a balance. And as I said, to the credit of our staff, and that's why we have some of the tools like strategic decision making and some of the other aspects of the processes and policies in place to make sure we're using best practices to guide these decisions. But these are not easy decisions, and I can guarantee you these are not decisions that our staff take lightly.
Well, and that brings up the whole issue of getting to zero as a goal and how incredibly unlikely complicated that is in a system that involves too many humans.
Certainly our goal is always zero. And when you're talking about, child fatalities, I would say ultimately as a society, ideally, we wouldn't have any children in the care and custody of the state because they can be safely at home. So that's another way of looking perhaps at your term of zero. But speaking specifically around child fatalities, our goal is and always will be zero. At the same time, we also recognize that sometimes there are forces that go way beyond and way outside of any impact that a public child welfare agency can make. And can influence, and regrettably, as I indicated before, and as the data shows, regrettably, we have had child deaths here in Maine, as well as, to my knowledge, virtually every state in the country.
Yeah. Thank you for those answers. Are there other questions of Dr. Landry or Commissioner Lambrew before we return them to their messed up schedules? I don't see any. Molly, anything else we should touch base about before we quit?
Not from me, just a sincere appreciation from the department for your long day of thoughtful engagement. So I appreciate it.
And we all appreciate the department's flexibility in getting the right people here at the new time. So
I'm adding my thanks on behalf of all of our team. We do appreciate the thoughtfulness, the care and attention with which you come to these hearings, the questions, the criticism. We welcome that because we do better by listening, learning, and working together to improve. So thank you all very much.
So unless there's additional business to consider, I would entertain a motion to adjourn this special session of the HHS committee. And thank you all for your attendance, and thank those members of the community who listened in and learned along with us.
And thank you to Cheryl and Anna and Aaron.
Amen.
And I would move that we adjourn.
Second.
All those in favor? Thank you,
See
people.
you all soon. Thank you
all.
Bye.
Thank you, Cheryl.
You're welcome.
We
See ya.
did good.
Yeah.
You got your reverb turned off, and
I know. Go figure.
we got through a 5.5 hour session, so not bad.
And we're still here.
Yeah.
Bye-bye.
Thank you.